Everyone, and thank you for joining us today for this second International Who's Who in One Health webinar. We're going to go ahead and get started. I'm Peter Costa, and I'm on behalf of the One Health Commission, and in cooperation with my co-moderator, Jesse Blanton, we're most delighted to be with you here today. Today we're going to hear from a diverse array of speakers from all over the world with various backgrounds, interests, and expertise, yet united by this common mission to advance One Health. This webinar is being recorded. The archived file will be available on the One Health Commission website, and a link to the recording will be emailed to all registered participants within a few days following the webinar. All attendees and our panelists are in a listen-only mode right now. Questions will be fielded at the end of each presentation on a first-come, first-served basis. To ask a question, simply type your question into the question box located in your webinar control panel, like shown here. We'll be moderating the queue of questions and will help communicate your question to the presenters. Time remaining after each presentation will determine how many questions can be fielded by our speakers. Also, please keep in mind this is an online meeting, and so we're at the mercy of technology. If there's a power outage or a loss of internet connection, we'll work as quickly as possible to bring the system back online and proceed with the presentations as scheduled. If you are disconnected locally, you can reconnect to the webinar by using the same access link you used to join this broadcast. I'd like to take a moment and revisit our intended outcomes for today. The main objectives of this webinar are to connect One Health stakeholders around the world to better understand, share, and highlight individual and agency level efforts, to educate webinar participants about the One Health paradigm and the way of thinking towards improved health outcomes, and to create new strategic partnerships and networks for collective, purposeful, and coordinated action. To our speakers, we'd like to say thank you for participating today and for your continued support of One Health. Given the ambitious agenda before us and general nature of internet-based meetings, we're asking each speaker to please adhere to the 25 minutes allotted for your presentation. Also, please keep in mind there may be a 1 to 2 second delay in the changing of your slides during your presentation. So now, without further ado, I'd like to turn the webinar over to Dr. Cheryl Stroud. Dr. Stroud will be leading us off today. Cheryl is the Executive Director of the One Health Commission, and she'll be giving us our welcoming remarks. Cheryl, give me just 1 second. I'll get your microphone open. Cheryl, can you hear us?
Yes, I can. Can you hear me?
We can. Your microphone's open. You can start whenever you're ready and just let us know when we can advance your slides. Thank you.
Great. Thank you, Peter. And good early morning here in the U.S. And some of you, it's already middle of the day, but good morning and good afternoon to everyone, and welcome so much to this second International Who's Who in One Health webinar. We had such an amazing response when we did the first of these webinars back in November of 2014, and had a lot of people asking us to do it again. So I hope that that everybody can log on and make the technology work, and that we'll get a lot of good benefit and some good connections out of this webinar. Next slide, please, Peter. What I would like to do is give an extremely brief big picture overview and some updates from the One Health world, and maybe some of the things that we as a commission and the rest of the One Health community are doing to really connect, create, and educate about One Health. Next slide. And one of the points I hope to really drive home today, and that you really internalize and you walk away with it kind of in your subconscious, is that the collaborations that we need for this One Health conversation don't just magically happen. They start with relationships, and those relationships don't happen either unless we come together in conversations. So that's one of the things we're setting out to do here today, is to find, we're going to find out who's doing what and get to know who we might collaborate with, and create some of those relationships that will lead to collaborations in the One Health effort. Next slide. So I'm not going to go very much into just what One Health is in this talk. We don't have a whole lot of time. If you're interested in, I have a much longer talk on One Health that I'll actually be presenting in the CDC COCA call on November 17th. If you'd like to log into that, you could certainly do that. most people on this call will agree with me that One Health is not a new concept. However, it is a new professional imperative. We have to do this. Please, next slide, please, Peter. One Health, a lot of us feel like it's a pathway to planetary health. Getting us all working together can really advance our ability to deal with some of our planetary health problems. But one thing we don't often talk about, and we need to talk about more often, is that it's also a pathway to global security. Some of the underlying health conditions can really destabilize governments and populations and civil societies. So many of us feel that One Health is truly a ray of hope for the future because we're on an unsustainable course right now. Next slide. We're definitely stuck in our professional silos. This didn't used to be the case before we had so much technology and so much ability to really specialize. But now we're able to focus on one amino acid in one strand of DNA, and we forget to talk to our colleagues in other professions. We've forgotten how to bridge those silos. That's one of the things that we've got to do. Next slide. And we do have a lot of challenges. Our academic tenure processes don't necessarily reward transdisciplinary or interdisciplinary efforts. Our government agencies are in silos. Our industry, our corporate knowledge is proprietary. We don't often wish to share that. Our environmental resources harvest systems are very detrimental to our planet. We have destructive agricultural technologies that we need to rethink. Our publication systems is a huge problem. We have no access to each other's articles in each other's journals just because of the way the system is structured. Some of the open access publications is starting to change that, but we still have a long way to go to really be able to share knowledge across the disciplines. And we also have language barriers. Each of our professions has its own acronyms, and sometimes it's intimidating to us to not want to talk to somebody across a discipline because they might say something or use an acronym that we don't understand. So we have some challenges that we need to be cognizant of and always approaching and addressing. Next slide. So real quick overview, the One Health conversation probably started not calling it One Health, but in the late 90s. In 2004, 2005, 2007, and 2009, the Wildlife Conservation Society began holding One Health symposia in Bangkok, in China, and Brazil. 2007, the American Medical Association, American Veterinary Medical Association actually partnered in a One Health Initiative task force. 2008, the FAO, OIE, WHO, UNICEF, and UNSIC, and the World Bank all developed a joint pandemic flu response plan. Next slide. In 2008, also, the One Health Initiative Autonomous Pro Bono team stood up their One Health Initiative website. This is a group of individuals who came together in 2006, and since that time have been doing a tremendous job of disseminating grassroots information about One Health and One Health reports and One Health actions. We owe a huge debt of gratitude to the One Health Initiative team. I think where we are today they've had a lot to do with the progress that we've made, and when you see our map for One Health Day in a few minutes, you'll realize just how far we've come. Next slide. In 2009, the CDC in the United States opened a One Health office. USAID in the United States established its Emerging Pandemic Threats Program, which you'll hear more about later from Dennis Carroll. And there was a One Health expert consultation in Winnipeg, Manitoba. Please don't get the impression that these were the only meetings going on. There were a lot of meetings going on by that time around the world. Next slide. In 2009, the One Health Commission was established. Next slide. 2010, the OIE, FAO, and WHO actually published a One Health tripartite note. This was a pretty landmark thing for them to come together and agree and publish something saying that One Health approach was an extremely important thing for everybody to address. Next slide. 2011 saw the first International One Health Congress in Melbourne, Australia. There was also a One Health Congress in Africa that year, sponsored by OCHA. And the tripartite, the FAO, WHO, and OIE, organized a high-level technical meeting in Mexico City. 2012, the USDA here in the U.S. stood up a One Health Coordinating Office. which is still operating. In 2011, in 2013, the second International One Health Congress was held in Bangkok, Thailand. Next slide. In 2014, there was an International One Health Research Symposium in China, and a number of other meetings were going on. Minnesota started holding its ICOMOS conference. 2015, the third International One Health Congress was held in Amsterdam in the Netherlands, and also last year the World Medical Association and World Veterinary Association joined together in a joint One Health meeting in Madrid, Spain, which is, they're having another one of those in just a few days in Japan. Next slide. In 2015, last year also, the One Health platform was created and launched. This is a very research-oriented group of One Health stakeholders and advocates that is overseeing the international congresses now and have created the One Health Journal. That's another place to publish things, because it's sometimes hard to find an appropriate venue to publish transdisciplinary research. And also it's a place to publish One Health news and information. Next slide. So as we were doing One Health Day, we became aware that with so many of the groups around the world we were aware of. In fact, when we did the first International Who's Who in One Health Conference webinar back in 2014, we were just starting to learn about groups all around the world. And now we're much further along in learning and understanding, but just in the past few days, almost every day, I become aware of another group in some part of the world that's working for One Health. So this is just some of the logos I was able to grab kind of quickly. I'm sure there are others around the world, but it's pretty impressive the progress we're making for a One Health conversation. Next slide. So we're now, you'll see this map again later. This is the map for One Health Day for this year. It's absolutely amazing and exciting and impressive. You're getting a visual image of all the places around the world where One Health has taken purchase and people are actually working actively to promote the conversation in their areas. So that's a very important visual imagery of places that we're working for One Health. And this map was captured a few days ago. I know that we're probably up to over 140 events going on for One Health Day now. Next slide. So the One Health platform and EcoHealth Alliance and a number of other groups have partnered to hold the One Health EcoHealth conference in Melbourne, Australia. So that's the 4th International One Health Congress. It's on December 3 through 7. It's kind of expensive to get there. I wish I could get there. So that conference is happening, and I'm sure it'll be an amazing conference. And then also I mentioned that the World Veterinary Association and the World Medical Association, working with the Japan Medical and Veterinary Associations, are holding their second global conference on One Health in Japan just in a few days, November 10th through 11. Next slide. I'll just mention now that the Smithsonian Institute here in the U.S. is working as we speak, creating an exhibit that will be housed there in the Smithsonian Institute, actually in the Museum of Natural History in Washington, D.C. It's coming in 2018. The exciting news about this is that they've raised enough money that this exhibit, it's on zoonoses in One Health, this exhibit will be housed there in the museum for 2 to 3 years, but it will also go on the road and travel internationally. So they're working on that plan also now. So keep your eyes out for that. Next slide. So what can we do? We all agree that this needs to happen. A lot of us over the years weren't real sure what to do about it. Next slide. So we felt extremely important that we start finding out who's doing what and find ways that we could join hands and work together. So the Commission's been working for some time to set up a Who's Who in One Health page on its website. It's still very much a work in progress. We hope that this map on the right will evolve into a map like the one on the left, like we're doing for One Health Day. but we're still desperately in need of information and contact information for all the groups. So this webinar today is a plea for you guys to help us get everybody who's working for One Health on the map. Please contact us. Next slide. We're also, as we mentioned, we're doing these international Who's Who in One Health webinars to help us find out who's doing what and to meet each other and get to know each other and feel comfortable reaching out to each other. Next slide. We've managed to create our Listserv, our global One Health community Listserv. The One Health platform also has a Listserv. I'm sure each of you as organizations have your own Listservs, and that's a wonderful, powerful thing. It's a way for us to share information. If you would like to add your name to the Commission's Listserv, you can do it by going to the Commission's website, going to resources, and dropping down to join the global One Health community Listserv. We are sharing with that community now the One Health Happenings news notes. Some of you have seen them. I hope that if you haven't, or some colleague of yours has let you know about this, that you can get signed on to get these. These notes are only as good as the information people send us, so please share information. Thanks, thanks so much for doing that. Next slide, Peter. And we're also trying to identify areas that need more conversation and to do educational webinars around those topics. For example, the Understanding Bartonella. It turns out Bartonella is a very significant human pathogen that has not been recognized as a serious human pathogen. So you'll find these webinars recorded on our website. The one on the lower left there was two webinars we did with Dr. Laura Kahn on antimicrobial resistance based on her research for her book, One Health and the Politics of Antimicrobial Resistance, and also a conversation that she became quite aware of as she researched about antimicrobial resistance in the environment. Not too long ago, we also did a webinar on Taenia solium, cysticercosis. So if you have a topic that you think that would be good for us to bring more conversation to the forward on, please let us know, and maybe we can work together to do a webinar. Next slide. We feel it's extremely important to get students involved early and get them forming relationships across disciplines early. Students have not yet climbed into their silos. They are so very comfortable still talking with colleagues, other students from other disciplines. So we have been able to provide a space on the website for students. If you go explore that, you'll notice that we're able to help them highlight some of their activities. There's also a listserv for the students for One Health that we're really still working on how to make it more interactive. Then there's a Who's Who in Students for One Health webpage for them to be able to find each other and connect. Also for students and for everyone, if you'll look at the lower left panel, we're accumulating and sharing with the world opportunities and education and grants and jobs, and hoping we're going to set up a mentor program for our students to match them up with One Health researchers and advocates. So we're trying very hard to support students, and I think we're going to hear later on in the webinar today from two of the student representatives on the One Health Commission's board. So very excited about having students involved and being able to facilitate their interactions. Next slide. Also on the webinar, on the website for the Commission, you'll find a few upcoming events on the One Health Initiative website. On the Commission's website, we'll try to list all the events for any given year. You would actually click on the year you're interested in, but we are even trying to put an easy place to find events that happened in the past. So if you go to our events page and you see that you know of some meeting that happened in 2012 that we don't have listed, please let us know, because I think it's extremely important for people new to One Health who come to one of these websites to be able to see, oh my goodness, well see, there were like 4 events in 2004, and then they go to 2016 and the page just goes on and on and on. So it's a very powerful statement about events happening around the world for One Health. So this is kind of a place that we'd like for you to help us get information posted, so send us information. We also have a Narratives in One Health and One Health Actions page. This is a page because we feel that One Health can provide a safe, no judgment zone for many of our needed conversations. Sometimes they're very controversial and difficult to have. We feel that this is a place where anybody can bring forward or suggest, publish an opinion piece, or we could put case studies here, places where One Health was successful or opportunities that we missed. We can publish them here on this Narratives in One Health in Action page. So again, that's an opportunity for everybody to get involved. Next slide. We've also are trying to stand up One Health action teams. One of the teams we have stood up that we're very proud of is the Bat Rabies Education Team. We're actually calling it BRET because we noticed that nobody in the Americas was really teaching children and parents not to touch a bat. In the Americas, bats are one of our major reservoirs for rabies, unlike many of the countries that you guys are in where the dog is still a reservoir. So this is just an example of the action teams that we can stand up. We're hoping and working towards standing up action teams on food safety issues and on antimicrobial resistance and human-animal bonds. So these action teams are just made up of volunteers, anybody who's passionate about some topic and wants to get involved and help make a difference. So no, you don't have to pay any money or be a member of anything if you'd like to get involved in one of our action teams. Next slide. And just from the U.S. standpoint, we were able to write a letter from the One Health Commission back last year in June of 2015 in support of a suggestion by 7 of our U.S. senators for the United States to create a One Health platform in this country and to encourage the creation of the United Nations One Health platform. Next slide. And one of the things that's relatively new for the Commission and the One Health world that we're starting to work on together is to create a One Health education initiative where we could reach down very early, K through 12 and beyond, to start teaching children about One Health and One Health issues. Not so much the whole One Health term as some of the One Health issues. To take this to K through 12, educate the teachers and educate the children. If you'd like to be involved in this, please go on the website under Commission News and look at press releases, and you can respond to this and try to get involved. Next slide. And of course, One Health Day was a fabulous, enormous, exciting success. So next slide. And you saw this map a minute ago, but it's still so impressive to me to see all the bubbles of activity around the world and to see the areas that we need to work more to get more attention and awareness. So you guys, some of you are out there and in a position to be able to help us with that conversation, help the One Health world with that conversation. So I want to thank everybody across the world for their participation in One Health Day. It's just been an enormous success, and we've already started thinking about next year. Next slide. And one thing I'll mention is just as an additional tribute to One Health Day, watch for this, in the Journal of Infection Ecology and Epidemiology, which is published by One Health Sweden, will be publishing a special One Health issue this month that will contain some review articles of One Health training, research, and outreach across the world. There might be a few countries or a few regions of the world that were not able to get their articles prepared, so maybe we'll catch those later. But I'll keep an eye out for this. We're very excited about being able to start getting a big picture overview of who's doing what where so we can join hands. Next slide. So one of the drive-home points, and I hope you walk away from this webinar today, is that these collaborations that we need start with relationships, and those start when we give ourselves the opportunities, when we create the opportunities to come together in direct conversations to further the One Health conversation, to work on issues that fall under the One Health umbrella, and just to join hands. And after a while, actually, it kind of becomes, you start feeling like the One Health family. Next slide. So this is my call. I'm making this call every chance I get for us to come together and collaborate in a global One Health alliance. And Peter, I can't remember if that was my last slide or not. Was that my last slide? I think that was my last slide. Yes.
Yep, that's the last slide. Thanks, Cheryl.
So I'd be happy to, yes.
Yep. Stand by. Jesse, do we have any questions in the queue waiting for Cheryl at this time?
There were several, I think, great thoughts and recommendations on possible future webinars, and we'll pass those along. There was one question from Michael Shacker, generally asking if there's funding is generally fairly low for student organizations within the One Health world. How do you propose that these student organizations obtain appropriate funding to get speakers that they would love to hear? And are there opportunities for students to obtain personalized webinars from notable One Health speakers?
Oh, those are some good questions. Funding is a problem for One Health across the board. I wish that I could say that the Commission was in a position to offer funding for students for some of their activities. We're working very hard toward trying to become a parent organization for Students for One Health chapters, so keep your eyes out for that once I figure out how to do it administratively. But at this point, it's just pretty much every man for himself for these student organizations finding funding. Some of them are fortunate enough to be in academic settings where the administration is supportive and is able to help them with some funding. But that is a huge challenge you've just hit, and we're all struggling with that. As to specific webinars for students, the Students for One Health the representatives on the board right now, there are actually 6 of them. 3 are voting and 3 are alternates, and then the voting rotate off after a year and the alternates become voting, and we bring in some more alternates. So we're in that process now, and that group is starting to get organized, and actually we have offered them the online support meeting mechanism for them to have their own meetings, and if they have actually had webinars already for students. So if I would urge your students, if they're interested, to please get involved with the Students for One Health, because if they want some webinars, they can work with that group and the Commission will support those webinars for the students. So I'm really glad you mentioned that.
Okay, I think we probably have time for another question, Jesse.
Thanks. Cheryl, we had one other question that was asking whether or not seeing One Health as somewhat of an old concept, but that do you think that there is an ethical imperative of One Health, that the ethical imperative of One Health is a new concept?
Yes. I think that we started realizing and recognizing that in the late 90s, early 2000s, when we realized that we had lost the ability to communicate across professions. So I do feel that's the reason I use that slide, that it's an old concept, but it is a new professional imperative. So if you ask if it's an ethical imperative, I would say yes. If we don't do something to change the course that we're on, and there are actually groups starting to really work on planetary health from a number of perspectives also, we're just unsustainable. We're going to destroy our world. So it is an ethical imperative, not just thinking about infectious diseases, but in thinking about educating the world about how we as humans integrate into the world. So many of us like to think, I mean, just by default, as humans, human nature tends to think that we as humans are the center of the universe, the most important species, when in truth we're just part of an ecological continuum, and we've got to find a way to live compatibly and friendly and gently on our planet with the other species. So yes, it is a new ethical imperative.
Great, thank you very much.
Thanks, Jesse.
I think that's all the questions at this moment.
Yep, thank you, Jesse. Thanks, Cheryl.
Thank you, Peter. Everybody have a great webinar today. I'll talk to you later on.
Thank you. Okay, we're now going to turn the presentation over to Dr. Peter Jolly and Dr. Joanna McKenzie, who are joining us. We're very thankful that they're joining us literally in the wee hours of the morning, all the way from New Zealand. Peter and Joanna will be talking about strengthening epidemiology capacity using a One Health framework. Peter, Joanna, give me just 1 second. I'll get your microphones open and we'll get started. Okay, your microphones are now open. I'll leave both microphones open during the entire presentation. Feel free to proceed whenever you're ready, and just let us know when we can advance your slides.
Thank you very much, Peter, and good morning, everybody. As Peter mentioned, it's 1:30 in the morning here in New Zealand, so if we're a little bit sort of dozy, just please bear with us. Just like to introduce Joanna McKenzie, who's co-presenting this webinar with us, and doing it on behalf of a small team here working from Massey University and in collaboration with other One Health practitioners here in New Zealand on a One Health capacity building initiatives focused mostly into South Asia. So Joe, do you want to say hello?
Good morning, everybody. So it's great to be with you, and despite the hour of the morning.
And we're hoping that many of our team who are currently working in these programs across South Asia, particularly the One Health Fellowship program participants from Afghanistan, Bangladesh, Bhutan and Nepal are also part of the audience here this morning. So next slide please, Peter. We've taken, or really started out in around 2009 looking at response to the emerging needs for building One Health epidemiology capacity across mostly South Asia in this instance, a way of using education as a way of building capacity. And we took an integrated cross-sectoral approach, integrating using education as a foundation platform along with organizational development, operational training, and then taking that into action through applied collaborative projects, working across human health, animal health, wildlife and environment sectors in a regional and multi-country approach. The key point we want to make here is that we used cross-sectoral cohorts both within countries and across countries to build foundational knowledge as well as relationships. And picking up on the importance of the point that Cheryl was making, we found this to be absolutely elementary and foundational, and the program was to actually break down those silos and build the relationships both within countries but also across countries, founded in common understanding and then common action. Our focus was on epidemiology and biosecurity, mostly in working with the endemic and neglected diseases in each country, as well as in preparation for emerging zoonoses, and working very much from a university background, but with government and non-government organisations and international community engagement. Next slide, please. Just to list a few of the projects, the main programs in Asia. The first was a One Health regional training in human and animal health epidemiology, funded by the European Union AHI facility trust fund administered by the World Bank. This program is now complete, but it was quite a substantial initiative over 5 years, where we took a team of 69 doctors and veterinarians from 7 countries through a joint master's degree training program delivered in country, and mixed this with a range of organisational development and project work in the countries, what we call education into action. The second cohort was a group of doctors and veterinarians from China and Mongolia, also funded by the World Bank. Next slide, please. And the current program that we're running is we term Integrating Education and Action for One Health in Afghanistan, Bangladesh, Bhutan and Nepal, funded by the European Union under the One Health program in Asia. And from our experience in the first program, we've now integrated this and condensed it even further into what we call a One Health Epidemiology Fellowship program. I thought it's also just worth mentioning briefly that Massey University in New Zealand is operating a veterinary education twinning program with the University of Peradeniya in Sri Lanka, funded by New Zealand Ministry of Foreign Affairs and Trade and the NZ Aid program. And that's one of the first programs under the OIE framework for developing veterinary capacity, improving health and reducing poverty through strengthened veterinary education. And the outcomes of that were presented at the OIE meeting in Bangkok earlier this year. Next slide, please. So the key components of the approach that we take is really this joint education, so using an educational framework of human, animal and wildlife health professionals to master's degree level. Master's degree level allows us to take a prolonged duration and more of a deep dive developing capacity in a way that's very different from the sort of short course training. So this long contact period, but we use a particular framework and platform here that can be completed either in service or dedicated cohorts focused on the program. In the first program, with the funded through World Bank, we started with needs assessment, working with the governments in the 7 countries involved to identify priority zoonoses. And remember, this began in 2009. And then critical needs and key constraints to a more coordinated One Health approach. Based on that needs assessment, we realized there was very limited cooperational frameworks in these countries, so we set out to develop the One Health hubs. So it's a national hub in each country, and then coordinated those into a One Health network, South Asia. So this is a very early attempt to bring these groups together in each of these developing countries. Next slide, please. But then, based on the needs assessments and then using the collaborative frameworks developed through the One Health hubs, we initiated, and with the master's graduates then as the key resources in these countries, implemented collaborative One Health projects focused on these priority zoonoses, critical needs and key constraints identified in each country. And then those projects really got the rubber on the road, what we call education in action, and they became the focus then for further international expert assistance and operational training built around the needs of the projects, say in terms of epidemiology skills, data analysis, and the wider dissemination of those results. We broadened engagement then, again presenting the outcomes of this work through national and regional workshops and One Health symposia, and the intention, the way these projects were designed, was so that the outputs could be used to inform policy development for these endemic and emerging zoonotic diseases. Next slide, please. So Jo, would you like to kick off in terms of the master's degree?
Okay, thanks Peter and Peter. So yes, good morning, good evening, good day to everybody. So I'll start with just a bit more of an in-depth look at the master's degree program, which is specifically designed for the joint education of multi-sectoral cohorts. We deliver the masters through a combination of online content and interactive teaching, which enables us to deliver this high-quality education internationally to reach and to teach people where they live and work. So next slide, please, Peter. So the Masters, as you'll see from this slide, it's an integrated program with a mix of papers that students from all sectors study together. So the first 4 papers are common papers that students will study together, which builds a strong epidemiological base, and also at the same time builds understanding of the perspectives and issues faced by each sectors through studying together and doing assignments and group work together. Then, in addition to the common papers, there's a number of specialty papers with material that's designed specifically for each sector, so for the public health, for animal health, and for wildlife health. So next slide, and back to you, Pete.
Thanks, Jo. And I think another key point around this was really just the function of education in this context is not just about educating individuals, but here you can see we're working with cohorts of quite large numbers of doctors and veterinarians across countries, building that common foundational knowledge and understanding, but particularly developing that relationship. And those relationships developed through the Master's Program have been forged in the heat of postgraduate challenge, and the challenge of studying in many of these countries was quite substantial. So they've been very enduring relationships we've found, and seeing education function this way has been a tremendous outcome. So moving on then into the various components, talking to the One Health hubs, providing that cross-sectoral organisational and operational framework for collaboration. These, under the terms of the grant where we're working with World Bank and others, were founded by agreement between the ministries responsible for human and animal health in each country, and involve those national institutions specifically responsible for zoonotic disease surveillance and control. The membership varied a lot between the way the hubs were constituted country by country. In some countries they kept this fairly tight to the government participants, and others, say such as Bangladesh, opened the membership very widely to a wide variety of organisations and individuals. So these became extending their resources and communication across the not only government but non-government and university sectors in each country. These One Health hubs we then used to, or connected to, form a One Health Network South Asia, which currently comprises about 700 people working specifically in One Health in South Asia across the region. Next slide, please. Diagrammatically, we can see this depicted where we had the hubs with the various organisations and individuals involved in the One Health Network. People could be members of the network without necessarily being a member of the hub, so they could be participating in the broader communications, even if they were not working individually in any country. This also provided a mechanism by which global experts and specialists could be contributing not only at a country level but also regionally. The platform that kind of created the existence for this was a web-based communication and a collaboration tool called HubNet. Next slide, please. Which is now continuing and supporting a range of networks, not just in One Health but also in food safety and food security globally. So it's a web technology that supported the One Health hubs. In this technology we can create communities of practice, and within those broader communities or networks you can create groups very flexibly and powerfully, and the groups, you can have defined roles within them, so you can create very secure, confidential platforms as well as more open networks. So it's a very powerful and flexible platform. It's based in open source software, so it's extensible and can be extended to others as necessary. And it allowed organisationally and geographically dispersed people to work together on projects, exchange ideas and consult experts. And if, next slide please, anyone's interested in seeing a little bit more about this, there's a website that explains a little bit what HubNet is at hubnet.org.nz. As I said, we've got a range of networks starting to develop through this. Some of them are national networks in New Zealand around the educational sector, Global Food Safety Partnership as a World Bank initiative, One Health Network South Asia, and working then supporting CIRAD and Institut Pasteur Cambodia, creating a One Health network in Southeast Asia as some of the current programs. Next slide, please. Joe's now going to talk a little bit about the collaborative investigation projects and how they worked.
So the program combines both education and applied components, as Pete was saying, the education into action. And the collaborative investigation projects are a very core part of the applied part of the program. These projects are implemented by multi-sectoral teams, by small teams, 3 or so people in each country, who work together in the field collecting questionnaire data, and in some cases collecting biological samples from people and animals, and then participate in joint workshops in which they use their data, such as workshops such as designing databases and entering their data, data analysis, and some more specialty topics such as spatial epidemiology and economic evaluation of control policies. Next slide, please. So through the projects, the participants are able to apply the learning that they've gained through the master's program and gain experience in designing epidemiology studies. Really, the whole gambit sort of that is involved in a research project, from designing it, from budgeting, from working out the logistics, project management, implementing the field work, analysing and reporting, and through to, in some cases, through to developing or recommending policy on priority zoonotic diseases in their country. And the projects also provide a focus for bringing participants into an international network or a network of international expertise through providing assistance through international mentors for the projects, animal health and human health mentors for each project, and then through the trainers and training in the workshops. Next slide, please. So on the left-hand column of the table that you can see in the slide, this shows the 12 collaborative investigation projects that were conducted under the first program in South Asia, which has now been completed. So you can see the range of projects there. And these projects provided the opportunity to expand the capacity building of the project beyond the individuals who undertook the master's degree into a much broader group of people and institutions in each country. So if you look at the bottom row of the slide, you can really see the numbers of the people involved in the project sort of scaling up through the different stages of the projects. So, for example, the masters in the first program, the 69 masters students formed the core of the design teams, and then the wider group were engaged in designing. So the numbers sort of doubled to so 148 people involved with the designing of the projects, and then increased by sort of tenfold for the additional people that were involved actually in implementing the projects and interviewing personnel in the laboratories and a huge range of activities, and then scaled out much to a much larger scale again, considering all the people that were actually included in the program. So it provided a very good way of scaling up the program, building capacity sort of in a applied context. Next slide, please. So in this slide you can see a range of photos of the project teams in action, collecting samples from people and animals, interviewing people, meeting with community leaders to discuss and gain their support for the project. Next slide, please.
So we then, as Joe mentioned, use these as projects as a focus for further training. And in this World Bank program now complete, there were 25 in-country workshops and 4 regional workshops providing advanced epidemiology training and study design, data management analysis, GIS and spatial multivariable data analysis, One Health economics and policy as examples. And through these workshops we managed to reach around 500 participants. And interestingly, some of those were up to the Director General level from some of these countries, where I remember particularly in the One Health Economics and Policy workshop we had Directors General from both sectors, human and animal sectors, in some countries sitting there shoulder to shoulder working through some of these issues, which was very very rewarding to see. And these were delivered by more than 40 human animal health and health economics specialists from over 16 countries. So it was a very diverse band of people. Next slide, please. The outcomes of the program were then presented through national symposia, which were attended by more than 700 delegates, and these really provided valuable forums for knowledge sharing and dissemination and then discussion of the program outcomes to national audiences, but in the context of other One Health initiatives. So the national symposia were really not just about what was happening through these programs, but also bringing together other One Health initiatives and presenting that in context. And they provided further opportunity for engagement with the country offices of the various international agencies, including the World Bank and the tripartites and key international organizations working in each country. Next slide, please. The outcomes from the various national symposia were then brought together in a regional One Health symposium, which was held in Bhutan, which was attended by about 120 delegates from the SAARC countries, including both technical specialists and senior policy directors, a range of international speakers and facilitators and representatives from the key international agencies. And this regional One Health symposium provided a regional forum then for that interministerial and cross-sectoral dialogue focused on the sustainability of the One Health platform and some of those key issues at the time. And I remember we had resolutions from that particular symposium, and I remember walking into the office of a senior policy director in one of the countries afterwards, and he had pinned the resolutions to the notice board in his office. And as we walked in, he said, I see this every day and think about what we discuss and the importance of that for our country. So it was very good to see some of those kind of impacts occurring. Next slide, please. So Joe's going to talk a little bit about some of the outcomes that were achieved through that first program, now complete.
So, touching on some key outcomes, building the collaborative investigation projects and the applied training around the initial and needs assessment in which we identified the priorities, zoonotic diseases and critical needs and key constraints for controlling these, resulted in a high level of engagement in the program because of the relevance of the work that was being done in the program. And through the program, we were able to amplify the capacity building impact of the program from the individuals who were initially involved in the master's degree out to multiple government and non-government institutions who are involved in managing health of humans and animals in each country. Next slide. And the program catalyzed where existing initiatives were already in place, strengthened One Health awareness and networks in each of the countries and in the South Asia region. It demonstrated the utility of the One Health approach in research and zoonotic disease control, particularly through the collaborative investigation projects. And it provided a platform from which new approaches to health problem solving can evolve in each of the countries. Next slide, and back to Pete.
Thanks, Joe. I think more than anything, we learned our way forward collectively, and not just from our point of view, but then working with the institutions in each of the countries and the participants in the program and the wider network of One Health people globally who were contributing. Which helped in the creation of the current program, which we've really used to condense what we did in 4 to 5 years in the first one down into a 2 to 3 year program, and what we're now currently running as a One Health Epidemiology Fellowship. Now this one is funded by the European Union under the EuropeAid One Health program in Asia, and is currently just coming toward the end of its first iteration. So this was implemented then in collaboration with local host and collaborating institutions in each country who have a very active role in co-creating and coordinating the program, including the applied epidemiology research, policy evaluation and professional engagement components. and the fellows or participants in the program are located at the host institutions, and they work full-time in this, supported by a stipend. The fellowship, importantly, whereas the master's degree training education is delivered and awarded, the master's awarded by Massey, the fellowship is actually a joint award between Massey University and the key collaborating institutions in each country. Next slide, please. So we're working very much to make this collaborative, and here's just a brief overview of some of the current organisational arrangements, working with our European partner LMU in Germany and Afghanistan, then the Health Protection Research Organisation and the government groups in the Public Health and Animal Health Directorates. In Bangladesh, a wonderful partner with the Institute of Epidemiology, Disease Control and Research, and Professor Rahman is talking shortly after this presentation, and the Chittagong Veterinary and Animal Sciences University there. In Bhutan, a collaboration between the University of Medical Sciences and the Royal University of Bhutan, the College of Natural Resources, and in Nepal through the National Zoonoses and Food Hygiene Research Centre and Agriculture and Forestry University. Next slide, please. So we're particularly dependent and grateful on to these organisations for managing the in-country activities and collaborating with us in co-creating the program in each country. Again, the core design principles, what we call education in action, the joint master's level education through the MVM MPH biosecurity framework that Joe's outlined, as well as a new degree we're just bringing through, which is a little bit more integrated again, NMSC One Health, which is launching next year. Again, this is very flexible, cohort-based delivery in country. Collaborating, as he said, with national institutions with a very applied focus on priority zoonoses and the applied epidemiology program, the mixture of situation assessments and applied epidemiology research, or CIPs, collaborative investigation projects, and bringing the outcomes of those through into economic and disease control policy evaluations. Next slide, please. The CIPs, again, focused on needs and priority zoonoses, provide very structured methodologies and a great focus for mentoring the country teams through the processes of project design, implementation, analysis and reporting. And remember, these are One Health programs, so these are projects that are involving both human health, animal health and wildlife representations from those three sectors. Working together on single projects. The outputs are then used to inform disease control policy evaluation, including economic analyses for these endemic diseases. And as in the previous program, the projects form the focus for further expert assistance and operational training, and then broadening the engagement through national and regional workshops and symposia. Next slide, please. Joe, you can just talk a little bit. This is our current cohort that we're very proud of.
So this is our current. I just have a slight delay in my slides coming through, so I think you might be seeing them before I do, Pete. So this is our current cohort of One Health Epidemiology Fellows, and who are now Master's graduates, and their hosts in each of the 4 countries. So top left we've got Afghanistan, top right Bangladesh, bottom left Bhutan, and bottom right Nepal. So we're very proud of all of the fellows who've done extremely well in a demanding 2-year fellowship, and we're currently working hard to bring them all to the International One Health EcoHealth Congress in Melbourne in December, with the joint funding from the Bill and Melinda Gates Foundation, the Massey University Foundation, and the PREDICT program. Next slide, please. So these are the 4 diseases, or not 4, these are the diseases in the 4 countries that were investigated under the applied epidemiology component of the program through situation assessment, collaborative investigation programs, projects, and economic evaluation of disease control policies. So the range of diseases was selected to achieve the aim of evaluating and demonstrating methodologies across a range of diseases and of different epitypes in the different countries. So that's all from me now. So it's been a pleasure to join you today, and I'll hand back to Pete.
Next slide, please, Pete. The outcomes of those projects within workshopped at a regional workshop on One Health economics and policy, which we were fortunate enough to be able to run in Bangkok and Thailand in July, August this year, co-hosted between Massey and the Government of Thailand, Ministry of Public Health. That provided a further opportunity to broaden the participation beyond just the 4 countries involved into the wider South and Southeast Asia community. And at this workshop we also had the senior policy directors working together with the technical specialists and were able to, as I said, socialise those concepts through the Southeast Asian One Health University networks and other key organisations and Thai universities. Again, it took a very applied One Health approach to the zoonotic disease control policy evaluation and economic analyses. Next slide, please. So, to sum up in general, the sort of overarching outcomes through these 3 capacity building programs, firstly, it wouldn't have happened without the fantastic support from the global donors, which has been crucial to our ability to develop and deliver these programs, which has been quite challenging from a distance in New Zealand. Now delivered then across 7 countries in South Asia, as well as China and Mongolia since 2010. The key that I wanted to say was the prolonged duration of these has allowed us to impact in these ways. These programs are running for 2 to 4 years, and to date we've got 108 graduates through the master's program in public health, animal health and wildlife health professionals, and around 2,200 participants in that wider spectrum of people actively involved through the workshops, seminars and symposia. Next slide, please. This is just final slide, just acknowledging the funding and key organisations involved, not least of which have been the government institutions, which are very almost too many to name in the countries, but tremendous level of buy-in and support from that, and then the key partner organisations involved in the current program. So with that, we'll say thank you very much, and thank you very much to the One Health Commission for this opportunity to present today.
Peter, Joanna, thank you for the fantastic presentation and the impressive work being done there at Massey. And we recognize now it's after 2 in the morning there for you in New Zealand, so we are very much grateful for the commitment. We probably were a little bit over time, but there's a number of questions that have come in. And Jesse, maybe we could just take one question and try to get through quickly and bring Dr. Rahman on next. Can we do just one question, Jesse? Sure. As Pete said, there were quite a few questions. But one of the first ones that came in, I believe, is regarding the MPH program from Chilos Lubinda. They asked, the current programs seem so far tuned somewhat to those in human medicine and veterinary medicine. Is there a consideration for future interdisciplinary programs involving remote sensing, modeling, climate change, etc.? I'll leave the question at that.
Thank you very much. So, I mean, One Health, it's a huge field. We're a small university from New Zealand, so whereas we'd like to say yes, and as capacity and funding opportunities present. So the short answer is these programs, particularly the MSc One Health program, is now designed to be very extensible, to be able to bring in a lot. Broaden the breadth of activity, but also the qualification and level in which people can come into those programs, whereas the MPH and MVM programs were a little bit constrained in that way. Second thing I'd like to say just briefly is that we're very happy to work collaboratively. So not only through building our own degree programs, but also to the way we contribute and work through articulation programs and agreements with others. So whereas we're a little bit constrained in terms of our own capacity in the regional location, we've got now extensible frameworks, quite a lot of experience in this kind of international offshore delivery, and we're fundamentally collaborative in our approach to this, so we're just open to conversations further.
Thank you, Peter. Thank you, Jesse. So Peter and Joanna, just so you both know, there are several more questions that have come in. And for our audience, so everybody knows, we will be taking all questions that we were unable to address during the live broadcast, sharing them with the presenters for the presenters to follow up with the askers, the participants individually after the webinar. Peter, Joanna, thank you so very much for joining us.
Thank you very much, and good morning, Prof. Raman.
Thank you.
Okay, our next presenter is Dr. Raman, and Dr. Raman is joining us from Bangladesh. Dr. Raman, in the sake of time, I'd say please go ahead and proceed whenever you're ready. Your mic's open. Dr. Raman is talking to us about the institutionalization of One Health in Bangladesh and following up on Peter and Joanna's presentation. Please, Dr. Raman, whenever you're ready, just let me know when I can advance your slides. Thank you.
Okay, thank you, Pete. Good morning, good afternoon, and also good evening, because people are connecting from different parts of the world. Welcome to my presentation in Bangladesh, where institutionalization of One Health in Bangladesh is taking place. So I will walk you through actually what has happened in this country from over the years and what progress has taken place in One Health in Bangladesh, and also what Hello, next slide. Yes, next slide, please. So we have, from our country, we started our initiative quite some time back in 2005 when we were working as a multi-sectoral coordination for the avian influenza pandemic preparedness plan, where we worked with both the human health, animal health, and also wildlife together to prepare this plan. There we started our One Health practices since then. And also we had the concept of multi-sectoral, multi-sectoral collaboration, coordination actions at the heart of One Health concept. And keeping in that mind, we from our own initiative, we formed a One Health forum in this country in 2007. And this happened with some of the members from all the three domain, especially from the human health, animal health. On the animal health, it is the we say fisheries and livestock, and also the wildlife group, and also we have brought into environmental people, and we have brought in other discipline people also in this endeavor. And in this forum, now we have got more than 400 active members, where there are representatives from 12 national and international organizations. So this is still ongoing, very actively, moving very fast. Next slide, please. So in that endeavor, we decided that we should have a One Health strategy developed for us in the country, and with the help from FAO, WHO, and UNICEF, we started working on that. In line with that, we have got approval, also actually initiative from the Health Department, where we say DGHS, Director General of Health Services, Department of Livestock, and also the Forest Department. We jointly convened a workshop to draft a One Health strategy framework, which was held in January, February 2012, and where we followed by a validation action plan development workshop. And later, this strategic framework was officially endorsed by all these three ministries, which is a great actually encouragement for us. Actually, the initiative what we took, which was not a government initiative, it was the initiative actually with the people from the civil society also, and all the other departments. And that document was endorsed by all the 3 departments, and also directive was given to the directorates so that they can take action in line with the One Health strategy document. Next slide, please. So you can see some of the actually evidences that how it has happened, where we got actually invitation from all the 3 agency heads all together, and also where we had UNICEF, WHO, and FAO also together, along with our One Health Bangladesh initiative. Next slide, please. So this is in that workshop. It was we had developed the country-level strategic framework and also multi-year roadmap for Bangladesh, and that is also in the website of IDCR. Anybody can go and see that if they want to. Next slide, please. These are also some of the evidences. The letters, those have been passed on from the ministries, but these are in Bengali, so probably it might not be helpful for all of you. But as I told you, that this letter not only approved the document, but also gave directives to the respective departments to take action in line with the strategy document. Next slide, please. Next slide, please. So this strategic framework was developed with the approach of to infectious disease and beyond, and where we had participation from all the UN agencies, research institutes, universities, civil society, and NGOs were also involved in that process. And also we developed the goals, vision, attributes, components, and identified with specific objectives. And this was a 5-year action plan developed. And also the key indicators for measuring impact of each activities were also identified in that workshop. And also people from the regional offices from WHO and also UNICEF also came down to attend this workshop so that they can also contribute in that. Next slide, please. So the vision was set up as the consequences of emerging, re-emerging, and high-impact infectious diseases are minimized through institutionalizing the One Health approach. So contribution to food security, food safety, and a healthy population in thriving ecosystem. And goals were established, institutional arrangement developed, necessary capacity, apply sound environmental principles. So these were the vision goals set up in that workshop we came up with. Next slide, please. In the strategy document, we identified 9 strategy components. First was institutionalization, institutional governance and program management. Second was coordinated surveillance. Next was coordinated outbreak preparedness, prevention, and response. I will talk on this a little bit later and give you some examples. And also doing applied research, developing network and partnership, strategic communication advocacy, capacity building, social economic aspects of disease, and also wildlife and ecology. So these were the 9 components which were identified in the strategy document where we work together gradually one after another so that these can be implemented. Next slide, please. And in the institutional governance and program management, the objective was set to ensure the institutional arrangement, policy framework, and management mechanism are in place to facilitate One Health approach to prevent re-emerging and high impact, emerging and re-emerging high impact diseases at the animal, human, and ecosystem interface, and ensured food safety and security. And we also developed a framework how this will work. Next slide, please. Here we have proposed for establishment of a One Health Secretariat in Bangladesh, and this we have identified that there should be a steering committee in the ministry involving all the three major ministries what we have identified initially. Though you can see here that there are four ministries: Ministry of Fisheries and Livestock, Ministry of Health and Family Welfare, Ministry of Environment and Forest, and Ministry of Agriculture. In our country, actually, Ministry of Agriculture is different than the others. So though we have identified four ministries initially, but actually to start with, we have started with the Ministry of Fisheries and Livestock, Ministry of Health and Family Welfare, Ministry of Forest and Environment and Forest. So that we have started with these three ministries initially, but there are provision for having involved the other ministries also subsequently. So we proposed an expert advisory group for this interministerial steering committee, and to establish the One Health Secretariat in any of the ministries, and also where we'll have involvement of the animal health activities, human health activities, and eco health activities in this secretariat activities, and also there will be some technical working groups working under that. So that was the idea when we started. Next slide, please. So this didn't happen very quickly, and we had to work hard to happen it. And finally, this year in 2016, on 14th June, an interministerial meeting was held in the Ministry of Health and Family Welfare with the involvement of the other two ministries, people from the ministries, and all the three agency heads were also involved in that meeting. And there was a decision taken to set up a One Health Secretariat in the country, and also it was also decided where it will be located. They have decided to be located initially with the human health sector, and as you know, you have heard from my previous speaker also about the Institute of Epidemiology Disease Control Research. He's working for One Health from day one, and it was decided to have that instituted in that institution, but it will rotate to the other departments also, and the steering committee also will be co-chaired by the other two ministries, but this will rotate every 3 years. And currently we have also developed the terms of reference of that One Health Secretariat, and it was decided that in the next steering committee meeting that will be approved, the terms of reference of the Secretariat, and also we have developed some mechanism how this will function, because there has to be secondment from the other two ministries. When it is held in the Human Health Ministry, the other two ministries will second officials there so that they can coordinate the whole activities and go along with the One Health activities. Mostly this will be a coordinating function. They themselves might do some development of some guidelines and also documentation, but they will also act mostly. The function will be coordinating with all the three departments and also feed in the tech steering committee also. So that is how we have already established formally with an official order from the government that this One Health Secretariat is going to function. And I would like to also mention that we have also have physical space identified to have a bigger One Health Secretariat in this institute, the Institute of Epidemiology Disease Control Research. Next slide, please. Now I will be sharing with you some of the One Health actions that has been taken place in this country, and you can see that initially I will give you an example of the avian influenza, and from the Institute of Epidemiology, whose responsibility for disease surveillance, outbreak investigation, training, and research. So we focused to have all the outbreak investigations to be held with involvement of the human health epidemiologist, the veterinarian, the anthropologist, and also the clinicians where necessary. So every outbreak investigation was taking place by involving all these three groups. If it is a known disease, or even it is not even a known disease, unknown disease also, this was being undertaken. Initially, it was at the central level, this initiative, but subsequently, this coordination went down to the district level and also at the sub-district level. So they were coordinating with the departments concerned to actually control the outbreak and also to take preventive measures so that it doesn't happen in this country. And as I mentioned about the avian influenza, as you know, Bangladesh is also one of the countries where we do a lot of work on Nipah. And Nipah, 4 countries, Bangladesh, India, Malaysia, and Singapore, these are the 4 countries who report Nipah regularly. Bangladesh is one country who reports Nipah regularly. And as you know, that the mortality rate is very high, and we involve the wildlife group here also to work with this. And I would like to mention that the Eco Health Alliance currently is, we have signed an agreement with Eco Health Alliance, Bangladesh government, so that they can give direct support with us on these One Health activities in the country. And in the past few months, last year there was a crow death, which you see now also in Delhi, in northern district of Bangladesh, where we have instituted large outbreak investigations involving all the departments together and came up with these findings that how this has been transmitted from the poultry to the wildlife and came back to the human. But though there was no human cases, but we had searched for those actually for human cases, but it was not found any of those. Not only that, going back to the avian influenza also, Bangladesh has reported 8 human cases of avian influenza in the country, and all these investigations were conducted involved all the 3 departments, at least the 2 departments, human health and the animal health, which were looking after the livestock. And I would like to mention here that we instituted a One Health approach surveillance system in the wet market in Bangladesh. In 16 markets we started, and where we work together with the having surveillance side by side for the poultry and also humans. And when we started that, immediately we could identify 3 human cases. Though there was no mortality, these were mild cases, but that helped us in identify human cases, and also this was helping one another, giving actually information. So this is a very much well practiced, and we have undertaken programs on the rabies program also involving the human and the animal together. And there are a lot of actions are being taken and also ongoing. And also for anthrax, as you know, we had a large outbreak in 2010 on the anthrax in this country, but we get it every year in the seasonally, and there also we do work combinedly with the animal health sector so that enough vaccination can be given to the animals so that it doesn't come to the human side. So next slide, please. We have initiated also another work, the 4-way linking, which is an initiative from OIE and FAO and also World Health Organization, where both the human health, animal health, AP, and the laboratory work together. And we have set up a network so that they can share data with each other and also get the information exchange also done at an earliest possible time, so that both the department gets benefited with this 4-way linking project. Next slide, please. Currently, for the last 2 years, we are working with the Royal Veterinary College and the London School of Hygiene and Tropical Medicine, and also in the country, the Chittagong Veterinary University Animal Sciences, and also FAO's involvement, and also the Department of Livestock and human health side on the Director General of Health Services, and the Institute of Epidemiology, School of Research, and Chatham House in London, the University of Queensland, Australia. All together, we started a program which is One Health approach, where we are looking for transitional and multidisciplinary approach for controlling the avian influenza. It has got a different segment, a huge big project for 4 years with integration of human-animal health policy together, and this will bring us a lot of information about this human-animal interface and also the avian influenza issue, which are a lot of unanswered questions which will come up, and this will continue for another 2 years. Next slide, please. In line with the One Health activities, the Chittagong Veterinary and Animal Science University has established a One Health institute in that university, and this has been approved from the university syndicate, and this has been established with the broad objective of One Health oriented education, research and training, postgraduate degrees and postgraduate certificate courses, and also coordinated surveillance program networks of community practices, and awareness building up on the threats and management of EIDs and biodegradation, and also promote academic and research programs and dialogue sharing experience among stakeholders. So as you know that today also we are actually celebrating One Health Day in Chittagong. It has started on the 3rd and 4th, both the days. A program is ongoing in that university to celebrate the One Health program, One Health Day in the country. Next slide, please. Just a few minutes back, also you've heard from the Massey University program, and we are also a part of that, where we have undertaken this One Health Fellowship program, jointly delivered by Massey University, Institute of Epidemiology, Disease Control Research, and Chittagong Veterinary and Animal Science University. So this is an initiative. Even before this, One Health capacity building education, there was also another MPH program also held before that. That was an online course, and also we as an institute also supported that program during that time. Also they did some projects also on One Health, and that was also supported from us from the IDCR. And the Sivasu University, the One Health Institute, is twinning with Tufts University. And one good thing has happened from the human health side. The FETP program, which has started 3 years back in 2013, we have taken now the 3rd cohort of students. Initially 2 cohort was only on the human health side, but in the 3rd cohort we have taken 2 veterinarians in the group. So now we have got 5 human health and 2 veterinarian in this FETP program, and this will continue, and probably this will have more share from the animal health side also. And also, as you know, that this is a 2 years program, and we have taken it to the University of Dhaka to have it MSc in Applied Epidemiology, and so it will take a long time to develop the manpower. So a 3-month course has already been developed, which is known as Frontline FETP, and these are with all support from USCDC. And this 3-month course program also, we are adding the people. These are focused on the geographical location wise, and the human health doctors who are working there from the sub-district level, they are brought in, and also side by side the animal health people are also brought in. So maybe of a group of 30, we are bringing 8 animal health, and the rest from the human health side for this training program, and this will continue for 5 years. So this will help a lot in building capacity building on One Health in the country. So these are also steps taken for One Health capacity building in the country, but there are short training courses ongoing all the time. And as you know, that One Health training are there on the lab and networking, and this is also an initiative from FAO that has been undertaken. Next slide, please. So as regards the One Health interventions, the One Health Young Voice for Next Generation Champions, this has been an initiative undertaken, and also community-based rabies control animal welfare practices, wildlife conservation and research techniques training, Relief International European Union One Health Community Program. So Relief International is also implementing some of the One Health program. They have a community program, and also this is one of the initiatives for One Health they are undertaking. And also there is Abhayaranno, another organization. They are working for the vaccination of the dog population in the country, and also some sterilization program. Next slide, please. So in this Relief International program, they have got awareness creation, behavior change, which is a part of the capacity building, and also there are integrated zoonosis surveillance within existing government regulations. So we are also taking care of the other component of the strategy document. Those are being set, and this is implemented by the Relief International, an organization, NGO, working in this country. Next slide, please. So coming to some of the other activities which has been undertaken to popularize One Health in the country, One Health movement in the country. We have conducted so far 8 conferences with multidisciplinary stakeholders involvement, 30 extended meetings, 7 annual general meetings, and we have so far at present we have 293 lifetime members and also 81 general members. So it is growing every day. There are a lot of enthusiasm in the group who are working in this field to be a part of this initiative and movement. Next slide, please. So I will move a little fast because time is passing away, though I started a little late. The 8th National Conference was conducted in 2015. The next conference we are looking for is the 9th One Health Conference, which we have planned to held it in March 2017, and hopefully we will be inviting people from the country and outside the country so that we can plan a big gathering here in this country next in 2017. Next slide, please. So this is a website that has been formed. Anybody can go there and have a look into in this website where they can get the regular updates and also the member list. Next slide, please. So this is the summary of the ongoing activities, which I don't think that I need to repeat it again, but these are all what I have mentioned so far. So probably I will shift to the next slide so that I can give a little bit more within the time frame. So this slide also shows the One Health milestone that has been undertaken, where we started in 2007, and the activities those has been taken so far, one after another has been shown here, where we have shown that the last one as the high-level consultation and interministerial meeting on establishment of One Health Secretariat, which I have mentioned early. Next slide, please. So this is a 4-step One Health approach model we have been practicing in this country, where we initially showed as a self-awareness building activities, which is on an independent specific context based, and then finally the relationships framework for action and also action taken. These are also another steps where we do shared activities also, where we have the ownership, coherence, and also continuous and sustained progress. So this is the model we are also applying and also following in the country to have the One Health activities undertaken in the country. I think I tried to give a little bit of an overview of what we are doing in the country and how much we are progressing. And this has got a sustainability issue. And I can tell you that a lot of things happen without extra funding, and a lot of funding also came from the government involvement. So I can tell you that the activities which has been undertaken so far in this country there are a lot of activities which will be sustained with the government initiative. Thank you very much. I have completed my presentation. If there are questions, I am ready to answer those. Thank you very much.
Dr. Raman, thank you very much. An excellent model for us to look at across the world. Jesse, I wonder, we have about 1 minute. I don't know if you have any questions for Dr. Raman.
Thank you, and thank you, Dr. Raman. There was one question from Joanne Lindemeyer. She was curious if ICDDRB had been engaged in any of the One Health activities.
Yes, with the shortage of time, I didn't mention all the activities. And one of the joint coordinator of One Health activities was also from ICDRB, which is Steve Luby, and also from US CDC. Also, there are secondment as One Health director also. So they are also working, and ICDRB is heavily involved in all our activities, as I have mentioned. I'm sorry that I have not, for short of time, I could not give you all details, but all the activities I have shown you, there are a lot of involvement of ICDRB, and they are an important partner for us.
Great, thank you.
Thanks, Jesse, and thank you, Dr. Raman. And as we mentioned previously, all unanswered questions will be forwarded via email. Thank you very much, Dr. Raman.
Thank you. Thank you, everybody. Thank you. Bye.
All right, thank you. Our next presenter is Dr. Prajit Nambiar. Prajit is joining us from the Center for One Health Education, Advocacy, Research, and Training in Kerala, India. And Prajit will be talking to us about One Health endeavors in Kerala to address complex health challenges and the center's role in its advocacy. Prajit, your microphone is now open. You can proceed whenever you're ready. And please just let me know when we can advance your slides. Thank you.
Thank you, Peter. A big hello to all the viewers here. My presentation is on One Health endeavors in Kerala to address the complex health challenges and COHEART's role in its advocacy. COHEART is a Center for One Health Education, Advocacy, Research, and Training. Next slide, please.
Prajit, can I just ask you to maybe speak a little louder if possible?
Yeah, please.
Thank you.
So as you can see there down in India in red color marked, it's Kerala. Kerala is the state in southern part of India. Some of the health challenges which are faced by the people of Kerala are due to the increased population and the urbanization here. As the human population increases, it adds on more demand for a protein-rich diets like chicken. Further, with the rise in population, the more interaction of man and animals do happen. As a result of which, there are chances of disease spillover from animals to man, leading to the emergence of disease. So such diseases such as Kaiserner forest disease, bird flu, Lyme's disease has emerged in Kerala. Our livestock productive system is currently intensified to meet the increasing demand for food. There are many ecosystem encroachments activities which are going on. This includes illegal cutting of trees, leading to the loss of forest cover, mechanization of agriculture causing the soil erosion, and also increased use of chemical fertilizers that can cause damage to the ecosystem. We are also exploiting our natural resources like land, water, forest, etc., leading to pollution and health hazards. As far as food insecurity is concerned, Kerala the insecurity is not due to the non-availability of food, it's rather due to poverty or insufficient purchasing power in some sections of society. Man-animal conflict are also common nowadays, and we have many monkey men and street dog fights, as well as the damage of crops from wild elephants and as well as other animals. To face such multiple challenges in health sector, we need to articulate a policy framework under which all the stakeholders can act effectively. Next slide, please. May I have the next slide? COHEART is an initiative by Kerala Veterinary and Animal Sciences University for ensuring good health for the nation. We endorse to the fact that One Health concept is the only solution towards complex health challenges at man-animal and the environment interface. This center was established in the year 2014 in order to propagate the One Health concepts among different stakeholders, to demonstrate the success stories using One Health approach, to empower human resources to face the challenging needs of the health sector. Our next step is envisaged in bringing about certain policy changes at government level for control of zoonotic disease, for which we need to draft a One Health strategic framework and get it endorsed by the Government of India and various ministries in order to form a separate One Health Secretariat. Next slide, please. So here I am going to cite few examples of One Health success stories in Kerala. The state recorded the largest outbreak of Kayasnur forest disease in northern Kerala, especially among tribal habitations adjoining the forest areas. The health department has reported nearly around 102 confirmed KFT cases. Parallelly, a lot of monkey death was also involved during this period. So here there is an involvement of man, the animal, as well as the environment, that is the forest. Next slide, please. So soon after the disease confirmation, cohort, that is the center, has organized a stakeholder workshop to initiate a collaborative action for the control of the disease. We had invited representatives from Animal Husbandry Department, the Health Department, the Forest and other allied departments. The outcome of the workshop is drafting a framework for an integrated Kayasnur forest disease control guidelines, which contained information on how to manage the disease in animals, how to manage the disease in man, and how to control the vector transmission. This guidelines was endorsed by the district administrator and order was put forth for implementation. We have also conducted epidemiological surveillance and public awareness programs. Next slide. Coming to the role of various other departments for controlling this disease, the health department stood forefront in vaccination of the risk groups. They have also conducted epidemiological investigation in humans to know the outbreak sources. They have organized interstate review consultative meeting. The significance of this interstate review meeting is because the neighboring state, that is the Karnataka, is already endemic for this particular disease. So what is the strategy which has been adopted there, that was also evaluated in this particular meeting. The health department also undertook door-to-door fever surveillance. They have convened frequent meetings involving different stakeholders, and also they conducted various health education classes. Next slide. The other stakeholders, such as the Animal Husbandry Department, who has surveillance of the monkey death as well as post-mortem of monkeys, taking into consideration all the biosecurity measures. They were also instrumental in control of vectors in domestic animals, because these domestic animals can also lodge these vectors and can act as a carrier of this particular disease. The Forest Department played a major role in reporting monkey death, disposal of dead monkeys, and also for controlled burning and dusting of insecticide powder around the dead monkey areas to control the disease. Next slide. So these are the other stakeholders, like the tertiary hospitals, the private hospitals, who have standardized the treatment regimen and also provided emergency services, inpatient care, as well as expert treatments during complication cases. See, the major population affected was the tribal people, especially the Tribal Development Department. They distributed compensation for those bereaved families. They also provided free medical services for those families. The laboratories are the instrumental in actually diagnosing the disease in humans. The media or the press was responsible for spreading awareness message as well as reporting the status of this disease. And we have another Center for Wildlife Studies in our university, which helped in the diagnosis of disease in monkeys, and the parasitology department has to identify the ticks in the affected areas. Next slide. So as a result of such collaborative control activities, there was a drastic decline in case as depicted in the graph. So in cut short, if you see this, the KFT control is achieved through a collaborative efforts of multiple disciplines. So we can have the next slide. So cite the next example. Yeah, here we have a case of Lyme disease. In the year 2030, a total of 6 women engaged in coffee plucking close to the forest area again developed acute febrile illness with rash and myalgia. They were not responding to usual treatment in local hospitals. On investigation, the blood samples showed positive for Lyme borrelio infection. Next slide. So the investigation approach is also a One Health approach, collaborative approach, wherein the health service department, after identification of this particular Borrelia organisms, conducted a joint investigation by the Department of Veterinary Public Health, the microbiologists, and the other parasitologists, etc. And as a result of such investigation, for the last 3 years, we didn't have any one single case of Lyme disease being reported. So the next slide. Yeah, this is how we have successfully managed avian influenza outbreak through One Health approach. So this outbreak was reported in the year November 2014 in ducks, and a Bhopal-based National Institute of High Security Animal Disease has confirmed this virus strain to be H5N1. Nearly 17,000 ducks were reported to be dead. Next slide. So soon after the outbreak, for the successful management, our university has organized 3-tier awareness program for local body representatives, staff from Animal Husbandry Department, farmers, and public. We have also developed an outdoor videography to reduce the panic in public. The surveillance team has visited the affected areas to take necessary measures to contain the spread of the disease. The surveillance unit has been stepped up nearly around 10-kilometer radius from where massive death of ducks has been reported. Next slide. So these are the other collaborating departments like the Animal Husbandry Department, who formed a rapid task force to cull the birds, the laboratories for identifying the disease in suspected birds, the physicians of the health department for prompt prophylaxis, the duck farmers who are the victimized, who were always prepared for the mass culling of the birds, the food safety officers who has given necessary advice regarding the meat consumption. That is, there is no need to panic as far as the broiler meat consumption and other things are concerned. We have the state government who has offered compensation to the farmers for culling of the birds, the central government team who has visited the area to probe the death in birds, the tourism department who was on alert, the public health personnel for all the biosecurity measures as prescribed by the WHO, the media and press to report the status of bird flu, and the police department to manage the culling of birds in order to reduce the public panic. Next slide. So if you see here, these are the examples of the successive One Health approach. We are also intervening on One Health activities for following health threats like rabies, foodborne diseases, waterborne diseases, man-animal conflict, the climate change, antimicrobial resistance, brucellosis, leptospirosis, disasters, and vector-borne zoonosis. Next slide. So now coming to the activities done by our center. One of the major activities of our center is offering PG diploma as well as PG certificate course in One Health. This course is for 1 year. The PG diploma course is for 1 year. These are the various course components. And we also have a project work, and in which the instruction is given on in order to conduct a collaborative One Health approach research. The PG certificate course in One Health will be completely online from next year, so that international students can also enroll. We also offer a certificate course in community-based disaster management. This is being offered from this year onwards. We are soon going to link our course with the International Society for Disease Surveillance. I'm happy to just receive an email from Dr. Laura, who was a previous director of ISDS, who was just wished me good luck for my center. Thank you, Dr. Next slide, please. So these are some of the IT resources which are used for One Health. So I'll just go roughly brush through these important resources. One such resource is a mobile app called as Purify. This app usually offers the doctors a spam-free and secure environment to communicate with each other. The doctors can refer the cases, interact with each other, and also can access to the specialty-wise development taking place in their field. If they are a specialty in dentistry, they get only the news or the updates in dentistry. Now, recently, we have also created this opportunity for veterinarians. That is, we are acting as their knowledge partner And now our next step is to link the veterinarians with the human doctors and to open a separate port on zoonotic disease so that both the human and veterinary doctors can interact. All this is available as a mobile app in Google Store. Next slide. So this you can see here is a web portal called as Worldwide Information Sharing Domain for One Health Movement. So this is a mission to reach out One Health to larger audiences. Actually, this is a quarterly newsletter come activity code exclusively for engaging audiences interested in One Health. We have the web address there, and it's of course in the final phase of completion. Once it is completed, we'll be opening for the public. Next slide. Another domain which we have in our center is Vetsinfo. Vetsinfo is launched with the motto of be the most informed veterinary doctor. So again, this acts as a monthly newsletter as well as a clinical case discussion portal. So the articles and case studies are shared to 100,000 plus veterinary doctors which are located all over the world, who has the provisions for commenting as well as discussing about the news being posted. Next slide. Another portal which we launched is Zoonotips. Okay, Zoonotips gives an insight for easy diagnosis and management of zoonotic disease, as well as creating public awareness of that particular disease. So we have a symptom analyzer which is attached to it, in which there are a series of questions which are asked, and based on that, the people can know which are the probable zoonotic disease which they have if they have an exposure risk to certain animals. Next slide. Yeah, this is one particular initiative called as Dr. Cohort. Dr. Cohort is a One Health advocate. That is, whatever activities which are done at the interface of human, man, and animal, the Dr. Cohort intervenes it and gives proper advices wherever required. It's an educational animated video. Next slide. Yeah, we have a health map at www.cohort.ac.in. This health map currently focuses on India alone, wherein all the events which occurs at human, animal, and environmental interface are color coded and described, and we can by location we can come to know. This is based on certain reports which comes on the newspaper, which are authenticated for feeding the information. Next slide. We have a program called as Health Food Safety Knowledge Connect. So this is online knowledge resource as developed by the center, and this through this web port we also offer online training on food safety. The web address is given as fs.cohort.ac.in. Next slide. There's something called as VetSend Pro. VetSend Pro is for easy identification of disease in animals, which can be used by all veterinary doctors as an app. So they just need to select any two cardinal features from the list of symptoms, and based on that particular features, we will be taking to the lot permutations and combinations, and we'll be telling what are the probable disease the animal has and what are the diseases the animal may have as a result of exposure. Next slide. We also developed a One Health documentary. Okay, this documentary, please watch it at our website, and this gives an insight on the bonding between the man, animal, and the surrounding nature. So please have a watch it. Next slide. So coming to our research component, we undertake research on zoonosis, we undertake research on man-animal conflicts, antimicrobial resistance, food safety, environmental health, and our other activities are climate change and the impact of climate change. So our students who are enrolled in PG diploma courses, they have to select some topics from this broad categories. Next slide. Yeah, this is how we advocate One Health. What we do is that we commemorate the most important days like World TB Day on March 24, Health Day on April 7, Veterinary Day, Milk Day, Environment Day, Zoonosis Day, and Rabies Day. So in these days, we organize various programs. We call different stakeholders. Then it could be school students, or it could be people from professional or various international organizations. We organize quiz competition, poster competitions, and other activities during these days. And all these days, we propagate the One Health concept. Next slide. Coming to this One Health Day event, there are a series of One Health events which we have undertaken this year, starting from the National Seminar for Sustainable Rabies Control, which was held in September 20th last month. Yeah. Then we also undertook, so one thing we propagate is that One Health concept, we just don't limit to zoonotic disease alone. We also introduce it to the non-communicable disease also. Then we also conducted the interface meet on food safety and public health. We also conducted this World Veterinary Day event, continuing veterinary education in collaborations with other the government departments in Kerala. We have also introduced the environmental health education week this year, where our students were propagated to plant trees, and each tree will be known by their own name, and they have to take care of it till the 5 years of veterinary study in our college. The upcoming event in the month of December 13th to 17th is One Health Research in Action Week. Next slide, please. Yeah, that is the way I'm just going to conclude my talk. Kerala has demonstrated the success stories of One Health to control the complex disease threats. We have propagated One Health concepts to our courses, online resources, and activities. Now we actually call for organizations both at international and national level to implement One Health in India in order to take policy level decisions. For that, we need the guidance to draft One Health strategic framework. I'm happy to hear the Rahman sir's presentation of how they developed a strategic framework. We also need to adopt such a framework. We also need to get strategic framework endorsed by the government of India. We need to form a One Health steering committee, and we need to establish a One Health secretary. There's some activities which are going on in the northern part of India, especially the Public Health Foundation of India, which has established its own started developing a strategic framework in collaborations with the massive universities, One Health Network of South Asia. They were under the able leadership of Dr. Manish Kapoor. Next slide, please. So, yeah, that is all the thing about our co-op and Center for Analytics. These are the activities which are done at local level. Now we want to go further into the national level and finally to the international level in order to adopt strategies. Thank you, Manu.
Prajit, thank you very much for bringing us back on time and for that excellent presentation. And it's really interesting to see the demonstration of how Cohort and others are leveraging technology to advance health there in the country and in the region. Jesse, can we have just a few minutes before we go to break here. Is there a question for Dr. Prajit?
There are quite a few compliments on the great work that Dr. Prajit has been working on. I believe particularly several people are interested in if there's a possibility that more information about some of the, and access could be given to some of the apps that were developed and that he spoke about.
Yeah, surely. All these apps are open and freely downloadable also. And the one app which is developed by Purify company that can be available in the Google Store. The Vet Sign Pro app, that app we are actually under trial run. Once it is completed, we'll be launching it into Android mobiles.
Great, thank you very much.
Thank you, Prajit. And if any more questions come into the queue, we will be forwarding them to you and to all the speakers after the webinar. Thank you very much for your presentation. All right, so that's the time we have for this first session. We're going to take a short break and we'll resume with the presentation from Dr. Dennis Carroll. We'd like to say thank you to all of our presenters for this session and for our listeners. Our next session is scheduled to begin in just 10 minutes. excuse me, to 15 minutes. So we'll hope that you'll join us back. We'll be back in shortly. 15 minutes. Thank you. Hi everybody, this is Peter Costa, just cutting in to let you know we'll be getting started here in just a couple minutes. So a couple more minutes break and we'll get going with our second session. Thank you. All right, we're going to go ahead and get started. So welcome back from the break, and for those of you just joining the webinar, welcome. Just a few reminders here. As all attendees, just as a reminder, all attendees are now in a listen-only mode. Questions will be fielded at the end of each presentation. To ask a question, simply type your question into the question box that's located in your webinar control panel as shown here. We'll be moderating the queue of questions and we'll help communicate your questions to the presenters. Again, please keep in mind we're at the mercy of technology, so should there be a power outage or a loss of internet connection, we'll work quickly to bring the webinar system back online and proceed with the presentations as scheduled. If you're disconnected locally, you can reconnect by using the same access link you used to join this broadcast. To our speakers for the second session, we'd like to say thank you for participating today. And given the ambitious agenda, asking each speaker to please adhere to the 25 minutes as allotted for the presentations. And also to please keep in mind there may be a 1 to 2 second delay in the changing of your slides during your presentation. We're going to go ahead and we're going to come back across the Atlantic and we're going to get started with a presentation from Dr. Dennis Carroll. Dr. Carroll is at USAID, the United States Agency for International Development in Washington, D.C., here in the U.S. And Dr. Carroll will be talking to us today about the Emerging Pandemic Threats Program, Building One Health Partnerships. Dr. Carroll, give me just 1 minute. I'll get your microphone open and we can get started a couple minutes early if that's okay with you.
It's terrific.
Okay, Dr. Carroll, your microphone is now open. Please just let me know when I can advance your slides and feel free to proceed whenever you're ready. Thank you.
Great. First off, Peter, thank you very much. And to the One Health Commission, really thank you for organizing this really very special forum. And to all of those who are listening, greetings from Washington, D.C. Peter, if you could put the first slide on. As noted, this will be a talk about USAID's Emerging Pandemic Threats Program. And we see this as very much as a core commitment from USAID and the U.S. government for building One Health partnerships. Next slide. And it's important to appreciate that the Emerging Pandemic Threats Program, too, really is built on over a decade's worth of experience addressing the threats posed by emerging infectious disease. And it really first for USAID came out of our initial response in 2005 against the avian influenza H5N1 emergence and spread around the world. And on the basis of that experience and subsequent evolution of our portfolio in dealing with pandemic preparedness in anticipation of a potential pandemic variant of the H5N1 virus, and a further refinement of our attempt to understand the underlying dynamics about the drivers of influenza emergence under our Emerging Pandemic Threats and EPT Plus program, you'll see that over the course of the last 15 years, we've had a portfolio which has been operating in over 30 countries worldwide, and it reflects our global concern about the threats posed by emerging infectious diseases. EPT2 is the second iteration of the Emerging Pandemic Threats Program, which, as I said, itself was building on the experience we had specifically with avian influenza. If you could go to the next slide. And avian influenza was certainly for me personally, but I think for many of our colleagues, very much a wake-up call about how public health itself could not see itself singularly siloed within the human health sector. That events like H5N1 really underscored for us the shared vulnerability that we have with emerging viral threats, particularly when we consider the viral ecology, that we understand that the emergence of a new threat in humans is really the endpoint of a series of evolutionary events that began in wildlife, may sometimes interact with livestock, but ultimately move into people. And so as we think about our ability to effectively protect human health, it's inseparable, as we've come to understand, without really understanding the importance of animal health, both at the wildlife and at the livestock boundaries, but also in terms of ecosystem health. And so as our portfolio evolved, we understood that if we want to protect against emerging viruses, it was not simply waiting for the index event in a human, but really to move the detection, prevention, and response paradigm upstream, if you will, from the human back into the ecosystem where viruses are emerging in wildlife, in livestock, and really use that opportunity to pay particular attention to what we can understand about the underlying drivers of pathogen emergence, both the biologic, those things that are inherently specific to viruses, but also the behavioral, those things that we do as a species that enable viruses circulating in wildlife to spill over both into humans, but also into livestock. And by understanding those vulnerabilities allows us to understand how we might target behaviors and practices to preempt, disrupt, prevent spillover and ultimate amplification. And it allows us to target our response, not when the event is spreading easily through human populations, but really to develop a response portfolio that targets those upstream events. Next slide. And so EPT2, which builds on that sort of broad One Health strategy spanning wildlife, livestock, ecosystem, and human health, is today operational in 30 countries across Africa and Asia. And on this slide here, you'll see where those countries are. And it speaks to, again, our sense about risk and vulnerability. It's not surprising that when you look at the geographic areas we're focusing on, they largely align themselves, which are now well-known and well-published risk maps that show those parts of the world that are vulnerable to disease emergence, largely reflective on the diversity of mammalian and waterfowl and the diversity of viruses. And we know that largely within the equatorial regions of the world, inclusive of eastern and southern China, that we have tremendous risk in those geographic areas for potential spillover, amplification, and spread of new diseases. So our portfolio is really focusing on those geographic areas and thinking about the systems and capacities that need to be in place to prevent, detect, and respond to future emerging threats. Next slide. And towards that strategy of preventing and detecting and responding, it really is about building multi-sectoral partnerships that span human health, animal health, environment, agriculture, food security, economic growth, education, humanitarian assistance, and foreign affairs. From a development agency like USAID, our ability to speak across those different sectors institutionally, where we have long-standing partnerships with each of those sectors as part of our development portfolio, our EPT program has been able to exploit and really tap into that broad multi-sectoral platform that is inherently part of our development portfolio. Next slide. So EPT2 is largely a partnership that speaks to 3 specific domains along with some expanded partnerships within the UN system. We have PREDICT2, we have Preparedness and Response, P&R, and we have One Health Workforce. These are largely partnerships that are intended, one, to enhance our understanding of behavioral and biological risk. It's also about helping us to understand those policies and regulations that need to be incorporated into the normative practices of governments and private sector. And so you'll see P&R is really our institutional platform for taking the knowledge and insight of risk that comes out of PREDICT to frame it within the policies and regulations that are inherently part of good governance. And One Health Workforce is about those capacities, that human resource that needs to be in place across the entirety of that sectoral profile to ensure we have the skills and capabilities that speak to a One Health agenda. And very strong partnerships with the UN Food and Agriculture Organization that aligns itself very strategically with our PREDICT portfolio to really understand and really bring a concerted effort towards managing the risks associated with livestock value chains, and the WHO as a way of enhancing and strengthening our first line of response within the human health sector. Next slide, please. Let me now walk through PREDICT, P&R, and the One Health Workforce to talk about their strategies, their approaches, some of the accomplishments they've had along the way. First, on the PREDICT strategy, as I mentioned, first and foremost, this is our frontline investment in understanding risk. And it's understanding risk both in terms of biologic risk, understanding the viruses, understanding the underlying drivers that move in a virus of little consequence to potential high consequence in terms of the evolution within the virus itself. It's also understanding the events that can accelerate the movement of a virus from wildlife into human populations, either directly, as we have seen with Ebola or with Zika, or indirectly, as we have seen with H5N1 and other influenzas or HIV. And it's about understanding the dynamics that allow for both the emergence, the amplification, and spread. Next slide. So towards that end, PREDICT, which is a coalition of a broad cross-section of conservationists, genomics, behavioral scientists, informatics specialists, to really help us understand the behaviors and potentially the practices that allow us to think about risk at the interface between animals, wildlife, and livestock and people, to be able to characterize pathways of disease emergence by understanding animal value chains, and to really identify large-scale transboundary ecologic processes that underlie those activities that humans are responsible for driving the evolution risk. And so it's really operating across the areas of land conversion, animal production systems, animal value chains, and the broad interface in between forests, agriculture, livestock, and human settlements. Next slide. This analysis has really allowed us to begin to understand the geography of risk. And what we've begun to understand under PREDICT and PREDICT-2 is really the underlying drivers that propel a virus to move again from wildlife into people. And what we understand is that there are very significant contributions that are being made by human population, the encroachment of human population by way of settlements, by way of agricultural production, by the way of extractive industry work that creates habitat change and potentiates the movement of viruses by way of expanded interfacing. We also understand that these population pressures play themselves out most dramatically where there is the greatest mammalian diversity, which is really a proxy for viral diversity. And again, when you look at mammalian diversity maps globally, they really align themselves with equatorial distribution around the world. So when we look at where the greatest risk is, it is not surprising, as illustrated in these maps that you see, that it is very much aligning itself into regions within Southeast Asia, South Asia, the equatorial region of Africa, and the Americas. Next map. PREDICT has also allowed us not only to understand geographic risk, but it's also to understand what species of mammalian and populations that we have to be particularly concerned about. That there are over 5,000 mammalian species, but it's really that subset we have found over the last decade, essentially of rats, bats, and non-human primates. They are at the core of the spillover event, that these particular species have learned to have high frequency interaction with people. They've learned to coexist in many respects, but they also harbor phylogenetically related viral profiles that enable early adaptation and transmission between wildlife and people. So as we think about further understanding risk, our ability to pay particular attention to the viral profiles within these species allow us to be much more strategic and forward-leaning. The next slide. One of the consequences of PREDICT is that we have been able to use this process of characterizing and understanding risk to have discovered well over 1,000 novel viral agents within high consequence viral families over the last several years. And as you look at this map differentiating across what species that they have largely shown up in, again, you see that rats, bats, and non-human primates really speak to the primary reservoir of future emerging infectious disease risk. Next slide. What we've also been able to do under PREDICT is move from just characterizing novel viruses to also understanding their relative risk profile. And we've been able to use a combination of virus-independent traits, such as the abundance of the host that the virus may be infecting, to those things which are very viral specific, such as host plasticity, how many different kinds of hosts a virus may infect, that ultimately speak to their potential for proving to be future high-risk agents for human population. So as we've gone through those more than 1,000 viruses, we've been able to risk stratify, understanding their various relative risks that allows us to further monitor and evaluate their potential evolution as agents for human concern. Next slide. But ultimately, this knowledge, this insight about risk, both biologic and behavior risk, is central towards informing and helping to understand then what are the actions that need to be in place, both for risk mitigation, lowering the opportunity for those behaviors and practices that may be part of individual or communal level human practices, and to build those actions, mitigation actions, into the standards and norms within policies and regulations at government level. So our preparedness and response program, PNR, operating in 16 countries, is very much involved in helping national authorities understand the relative significance of the information coming out of PREDICT and other bodies of work that help national authorities and private sector partners to begin to align their activities, both with an eye towards reducing risk and to begin to prepare for earlier and better ways of managing and preventing and detecting future emergent threats. So as you can see from this slide here, one of the key areas of work that PNR is involved in is working with national authorities and our private sector counterparts to develop One Health national platforms, to create an institutionalized mechanism that allows for ministries of health, ministries of agriculture, environment, education, as well as private sector and non-governmental organizations to come together on a regular basis to share information, to identify areas of risk, to coordinate strategies and investments so that the long-term approach towards addressing emerging infectious diseases is not simply about coordinating an effective response after emergence, but is promoting the standards and practices that will engage and enable reducing the emergence and the spread of future risk in the first place. So it's very much a hallmark of bringing multi-sectoral partnerships into normative long-term partnerships. Next slide. And you can see that PNR in this slide really speaks to the strengths of multi-sectoral prevention, planning and response, institutional capacity strengthening, thinking about the institutional standards that need to be in place, the human resource capabilities that need to be in place within the government, within private sector, within communities to be able to be fully successful, to be able to support policy and advocacy, and to provide strong coordination with the private sector. And an important component of that private sector partnership is the extractive industry. As we have seen over the last decade, the explosion in economic growth around the world, but more increasingly within the developing countries of the world, we are seeing the demand and need for natural resources exploding. And as a consequence, we're seeing a dramatic incursion into previous wildlife pristine areas increasing, creating new opportunities for future interactions between wildlife and these extractive industry operations. So one of the areas of work of P&R is building working relationships with oil and gas and mining and agriculture to lower the risk in their practices to protect against inadvertent interactions and exposures, as well as spread of new infectious diseases. I want to also note, and in certainly the spirit of One Health celebrations, that next Monday, Tuesday, Wednesday, and Thursday in Dakar, Senegal, P&R, in concert with the Food and Agriculture Organization, WHO, ECOWAS, WAHO for West Africa, are bringing together 11 countries across West Africa, ministries of health, ministries of agriculture, ministries of natural resources and environment, to really consolidate a regional One Health alliance towards bringing a better enabled capability across that region to speak to the future of multi-sectoral partnership. Next slide. Ultimately, all of this work about institutions, about multi-sectoralism, about governments, about private sector, it ultimately comes down to the capacities within the workforce. And one of the major components of our portfolio under EPT2 is the One Health Workforce Partnership across universities, across Africa, and across Asia. And on this slide, you see that there are two major partnerships we have: One Health Central and East Africa for the Africa region, and the Southeast Asia One Health University Network. These are two important networks that are bringing together a constellation of schools of public health, veterinary medicine, medical schools, schools of environment, to build One Health curriculum so that at the pre-service learning level, the graduates of these programs for the future will have the insight and knowledge about One Health and build an operational relationship during their core education that makes them operatives for future engagement in the private sector and in the public sector. So if we go to the next slide, what we see is the breadth of the One Health networks from West Africa to Central Africa to East Africa and across South and Southeast Asia. Next slide. Most specifically, OSEA is an alignment of universities and schools in Cameroon, the Democratic Republic of Congo, Ethiopia, Kenya, Rwanda, Tanzania, Uganda, and most recently Senegal. There are essentially 14 core schools that OSEA is working in to transform the curriculum, elevate the teaching capabilities of faculty, and create a much more interactive partnership across the different schools for training that next generation of leaders across Africa in One Health competencies. Next. Similarly, in Southeast Asia, we have a coalition across Vietnam, Indonesia, Malaysia, Thailand, and I'm missing, but of 10 core schools. But more importantly, the Siahun core universities have taken this whole partnership one step further. And if you could go to the next slide. And what we have in each of the countries, in Malaysia, Vietnam, Thailand, and Indonesia, each of those schools, core schools, have spun off National One Health University Networks, or OHUNs. And there are now over 80 institutions across those countries. And we see illustrative here, the INDOHUN, the Indonesia One Health University Network, involves 35 faculties across 20 universities. This is a robust exercise being led by the universities themselves to really, again, extend the opportunity to building One Health principles and skills within the future medical, veterinary, environmental professional staff. Next. And we are doing this in concert with two universities from the United States, Tufts University and University of Minnesota, who themselves have brought an alliance of their schools of public health, veterinary medicine, medical schools, and schools of environment and nursing to align with both OSEA and SIAHUN to really enter into a shared venture of learning and doing. In the United States, we are also struggling with how to create that next generation of One Health leaders, and Tufts and Minnesota are learning as much from their partnership with SIAHUN and OSEA about how to adapt and apply these principles in the United States as the countries across those different networks are learning to do it as well. Next. So more importantly, the One Health workforce is about developing the core technical competencies that really speak to the international health regulation and the OIE PVS standards and norms. How do we make sure that those skills are shared and understood across the different sectoral domains? Next slide. It's also about the One Health workforce that speaks to operations, that speak to policy, and that ultimately speak to human resources. Next slide. As an example, the type of training which is cross-sectoral across competency domains, they speak to sector-specific competency domains, they allow for opportunities of joint external evaluations, they speak to OIE PVS pathways. It's a comprehensive approach to giving both an experiential as well as an academic exposure to the kinds of skills that will serve future professionals both in the private and public sector. Next slide. Ultimately, it's about empowerment. And our vision for One Health workforce is really about building the long-term competencies that are needed for achieving the long-term success of One Health. It's about transforming not just the competencies, but it's transforming the vision that ultimately drives ministries, that drives the private sector. And it's that next generation of leaders that are the product of the university systems that compel this forward. Ultimately, it's also about in-service training, and though I haven't mentioned this, there is a significant body of work of investing in current leadership to bring that current leadership in each of the countries where we are operating in Africa and in Asia to develop greater insight and greater skill sets for One Health. Ultimately, the vision that USAID has for One Health is mainstreaming this across the entirety of a multi-sectoral shared vision and creating a long-term platform for promoting a much more integrated horizontal approach to thinking about risk and ultimately executing risk mitigation. Thank you.
Thank you, Dr. Carroll. First, let me say super fascinating presentation and really interesting to hear about the work going on across the One Health networks. I know that there were several questions that came in that I think you may have answered throughout the course of your presentation, but let me turn the cue over to Jesse in case there's, we probably have time for probably one question, Jesse.
Sure. One of the first questions that came in was from Saddam Hussein. He asked, first question is, are USAID only funds for emerging disease threats, or are funds available for other zoonotic diseases that have public health significance?
Well, first off, our investment is looking at the systems and capabilities that would enable a robust approach towards all zoonotic diseases. Our metric will be looking at metric for success will be looking at the impact we've had on potential emerging infectious diseases, but the systems, the skill sets, the policies, the institutional relationships are indivisible. So we use normative zoonotic diseases. We can think of rabies. We don't invest directly in rabies control, but rabies response is a brilliant example, when done well, of One Health in action. So we have across the globe supported One Health actions against rabies as a way of bringing together ministries of health and ministries of agriculture as, if you will, a learning moment for how to execute in the midst of an endemic zoonotic disease threat, ultimately as a way of helping them understand what they need to do in the event of a future emerging infectious disease. Hopefully that answers the question.
Thank you. Pete, do we need to go on, or we have time for one more question?
I think if you have another question, we can do one more.
Okay. Our next question comes in from Mac Farnham. Yes, first thank you, Dr. Carroll. It was a fascinating update. Can you touch on the recent Zika outbreaks in the Americas and the Ebola outbreaks in West Africa, two geographies that were not necessarily identified as high-risk areas for disease emergence?
Actually, if you look at the map carefully, the disease emergence risk for both West Africa and for the Amazon region is significant. And quite frankly, it was the underinvestment in West Africa, including underinvestment from my own agency, that allowed a virus like Ebola to have been introduced into the region and ultimately spill over and spread without recognition. Hopefully the investments we are making there now are ones that will ensure that the Ebola epidemic of 2014 never happens again, either for Ebola or any other zoonotic threat. Over.
Great, thank you very much.
Thanks, Jesse, and thank you, Dr. Carroll. These are important discussions, and thank you very much for keeping us on time. Any further questions that are in the queue will be sent via email for follow-up at your convenience. Thank you very much.
And again, my kudos to the organizers. Well done, and brilliant execution of time management on your part. Thank you.
Thank you, Dr. Carroll. Okay, moving forward, our next presenter is Dr. Tayo Babalobi. Dr. Babalobi is joining us from Nigeria, presenting on One Health Nigeria and One Health in Nigeria, present and future. Dr. Babalobi, give me just 1 second. All right, your microphone is now open. Please just let me know when we can proceed with your presentation. Thank you.
Yes, Peter. Hope you're hearing me. Okay.
Yep, we can hear you. Yep, thank you.
Okay. I thank you for this opportunity, not just to present One Health in Nigeria, and to also to learn from what is happening in other countries. I particularly have been impressed by what is happening in Bangladesh. I was discussing with one of our senior veterinarians in Nigeria about 3 months ago, who has some links with the OIE and the FAO, and he was talking about what was happening in Bangladesh. I was wondering why Nigeria is not going as rapid, as fast, and as expanded as Bangladesh. But I just focus on what is happening in Nigeria and the challenges we have. And can we go to the next slide, please? Next slide. Okay, next slide, please. Well, I made a reference to Bangladesh because we had this similar, the outbreak of avian and pandemic influenza in Nigeria actually raised for the first time the need to bring human health and animal health together for multidisciplinary response. And it was a good experience, only that we are not able to institutionalize some of the experiences we learned there. Let's go. Next slide, please. Next slide, please. When the avian influenza challenge came in 2006, the federal government of Nigeria has already made some preparation, and with the outbreak, there was a joint committee of the Federal Ministry of Agriculture and Rural Development, Ministry of Health, and Ministry of Information and Communication. Nigeria also was lucky at that time to have a president who was actually a poultry farmer. So he realized the need to actually tackle avian influenza, especially from the, not only from the zoonotic aspect, but also from the socioeconomic effect. Next slide, please. And apart from running a successful collaborative joint avian control project, the avian influenza outbreak also led to the establishment of the Nigerian Field Epidemiology and Laboratory Training Program, which is about the only institution in Nigeria that is actually actively proceeding with One Health with results and actions. Next slide, please. Well, the Field Epidemiology Laboratory Training Program that was started in Nigeria actually was the first one worldwide. Of course, it was started by the CDC. Was the first one that actually introduced the veterinary component to One Health. Let's go. Next slide, please. Like I said, the human and animal health care, they came together, and I mean, we were, as it were, forced to work together to prevent the avian influenza outbreak. As I said, the Nigerian Field Epidemiology and Laboratory Training Program was the first of the program worldwide to train, to bring together veterinarians, community medicine, laboratorians, I mean, working together since 2006, and they have produced so many One Health professionals, where there were, of course, 3 track, the field track for physicians, the veterinary epidemiology track for veterinarians, and the laboratory track. But they trade together, they work together, and in addition, it also brought 2 institutions. Next slide, please. It brought 2 institutions: the Ahmadu Bello University in Zare, Northern Nigeria, the Department of Community Medicine, and the Department of Veterinary Public Health in the Ahmadu Bello University, and in the Southwest, we have the Department of Epidemiology, Medical Statistics, and Environmental Health, and again the Department of Veterinary Medicine, Veterinary Public Health, and Preventive Medicine, working together on the same education NPH program. Next slide, please. Since its inception, the Nigeria Field Epidemiology Laboratory Training Program has responded to 103 suspected outbreaks, ranging from environmental-related outbreaks, vaccine preventable disease, water and foodborne zoonosis, including viral hemorrhagic fevers, as well as neglected tropical disease, and played actually a great role, an active role, in the control of the Ebola outbreak that came to Nigeria recently. And also, incidentally, the control of the coordination of the polio eradication. Next slide, please. The polio eradication in Nigeria actually is also coordinated for one of the products of this program. So there have been improved laboratory diagnosis, the same MPH, Master and Public Health degrees with 3 professions. They have together investigated the avian influenza, the lead poisoning. These are just examples TB investigation, they work together in all this investigation. Next slide, please. Well,
Dr. Babalobi? Right, it appears that we may have lost Dr. Babalobi. Let's just be patient and give him a minute to try to log back in. Hi, everybody. The webinar is going to continue. Please thank you for your patience as we continue to try to bring Dr. Babalobi back online. Hi, everybody. This is Peter. We're still working to bring Tayo Babalobi back online. I would encourage you now that if you have any questions, either for Dr. Babalobi or for any of the other presenters that you've heard so far today, now would be a good time to enter those into the queue if you've not gotten a chance to do that so far. And thanks for your continued patience as we work to bring Dr. Babalobi back on. If we're unable to bring Dr. Babalobi back to the webinar, we'll work with our next presenters to see if we can move forward with the webinar. So thank you for your continued patience and give us a few more minutes. Thank you. Okay, everybody, we appreciate your patience. It looks like we're going to be unable to bring Dr. Babalobi back on. Our next presenters have agreed to begin early. They were not scheduled for another 15 minutes. So please just, Risa, Akil, give me just a minute. I'm going to advance the slide deck, open up your mics, and we'll get started in just about half a minute here. Hold on just a second, please. Oh, Dr. Babalobi? Dr. Babalobi, can you hear me?
Yes, please. Shows the power cut off. It's just embarrassing.
Well, we have about 10 minutes left. Would you like to try to finish your presentation?
Okay, I will just try to rush through it. Yeah, hold on.
Okay, let's
embarrassment.
I'm glad we were. No, that's okay. This is the way that these webinars go. So please proceed. We'll get through what we can, and just let me know how I can advance through your slides for you.
Okay, just go straight. Change the slide. Move forward. Okay. Yes, the next slide, please. Next slide, please. Okay, next slide. Sorry. Yes. Okay, now. Apology for that power break that happened, but we're back now. So can we go to the next slide? I'll just try to rush through the next slide, please.
Sure.
Okay, so we were here when the power break occurred. That's just what I was saying. The felting program played a key role in the Ebola eradication efforts in West Africa, and even the current AI resurgence in Nigeria. Next slide, please. Well, we can move forward. I placed a part in of the curriculum. We also set up a One Health Nigeria global group in 21. That has been apart from the FELTIC program, this global group has been the most interactive group as of a few days back. There are about 323 members, which is too small, but we actively discuss One Health issues in Nigeria. Next slide, please. The next slide, please. Also, the avian influenza outbreak also was an opportunity for the Nigerian Medical Association and the Nigerian Veterinary Medical Association to work together. In 2008, we had two proposals, one of which was adopted, and the second one, which was to actually build up a partnership, was stepped down, but was reactivated. Next slide, please. A few years back, in which we decided to have a joint Nigerian Medical Association, Nigerian Veterinary Association publication with co-editors of 3 members of both associations. Well, it has not started, but the proposal has been accepted. Next slide, please. The next slide. Now, these are the challenges we are facing. The One Health in Nigeria should have gone beyond the stage we are. I was making reference to the Bangladesh presentation. We had lack of coordination, leadership, individuality of both. When I talk of NMA and NVMA, I talk of Nigerian Medical Association and Nigerian Veterinary Medical Association. So we are talking about the members, not at, that work together over the AI. So there was still, and there's still, professional suspicion, which are mistrust, professional arrogance, professional ignorance. These are the challenges which we are still trying to face. Next slide, please. Next slide, please. Maybe I'll just continue talking. Even at that, as far back as 2011 and 2012, where I did my sabbatical leave with the Animal Health Interface Project in Nigeria, and that was around the same time the Nigerian CDC was established. And together with the then director of the Nigerian CDC, Dr. Nasidi, we drew up a proposal for a National Committee of One Health to host a One Health Summit in Nigeria. Up till now, it has not been effected. That's about 4 years ago. Next slide, please. Maybe I just continue to talk. Well, one of the factors which we have mentioned before was even when Dr. Nasidi was the managing director of the Nigerian CDC, proposed that we should set up a One Health office in the just established Nigerian CDC. There was no cooperation from our side of the profession and leadership. I would say if we started at NCDC, what about starting another one at the Ministry of Agriculture? Because the NCDC is under the Ministry of Health. So even from our side of the profession, there was some, there were some challenges which we are still trying to act. And there was a suggestion that why don't we have the One Health Nigeria as a NGO, which would contain representatives of the various individual, governmental, national, professional, and other stakeholders, as well as the global One Health network. We are still at it, but of course, yes, next slide is one of the emphasis that I'm making now is my workplace at the University of Ibadan. I didn't talk about the history of One Health in Nigeria because it came before 2006. It started from my workplace at the University of Ibadan. I started with outbreak of Listserv fever in 1969, in which the mainly veterinarians, microbiologists, pathologists, parasitologists, physicians, few physicians who are working in the virology department of the College of Education, College of Medicine at the University of Ibadan, under the leadership of a Briton, Professor Montfiore, who brought all these different professions together to work at the virology department of the College of Medicine in Nigeria. So I've been trying to challenge my university that, look, you had a pioneer role, which we also take up. I was glad when I had Dennis also talk about the place of the universities in promoting One Health. Next slide, please. There have been proposals, to develop a One Health Center in Nigeria. And I also want to, while emphasizing the role of the university, I also want to emphasize that one of the factors which, as I was listening to Dennis' last presentation, he talked of so many countries that the USAID and their various programs have been involved in developing One Health. But I mean, of course, Nigeria is not there. Well, Nigeria has never had any, apart from the Nigerian Field Epidemiology and Laboratory Training Program, has not had any international grant or support, to actually, especially in places. Please, next slide. In such places that the USAID is doing. Like I said, we are working, I've been proposing that let the University of Ibadan, we have a field station which is for veterinary field station, which we want to return and been making a proposal as part of the 2015-2019. We want to turn into an international One Health Center. With the cooperation of international organizations such as the USAID, FAO, OIE. I was impressed by all the presentation by Dennis. We have all the material, we have all the knowledge of that, but the implementation in Nigeria is still very flawed. Next slide, please. I think I should be rounding up now. Next slide, please. So to move forward, why in Nigeria we need the input and support of international agencies like the FAO, the OIE, WHO. I was at the headquarters of all these three organizations, including the WTO, as part of the program by the University of Minnesota, engaging international organizations, and all of them indicated interests in working together as Nigeria, when Nigeria is, when they're needed in Nigeria, but there's still a long way to go, and of course the USAID. Maybe the last slide, please. Well, I thank you. Like I said, the Nigeria's Prime Minister with international connection actually pioneered and should be responsible to coordinate the sustenance through collaborative academic and research activities and community involvement. We have brought such proposals, but we need partnership, grant and support from international organizations. Thank you so much for this opportunity. And apologies for the cut in power supply, which is one of the problems we are facing in Nigeria. Thank you, Peter.
Thank you, Dr. Babalobi. I'm glad we were able to get you back, and we appreciate you still keeping us on time. And we still have a couple minutes, so Jesse, maybe we can go to the question log and see if we can maybe do one question for Dr. Babalobi, if there are any waiting.
Sure. We have one from Asmatullah Halimi. They ask if you could talk about the information sharing between human health and the animal health diagnostic facilities in Nigeria, and in your opinion, what would be the best approaches to address any issues there regarding sharing and communications between these facilities?
Yes, that is a challenge to us in Nigeria because even most of these laboratory diagnostic facilities, most of them are not actually up and doing, they are not functioning. I mentioned in my presentation that it was a virology laboratory in the College of Medicine in the 70s that was responsible for whether it was human and animal diagnosis. There are still other laboratories. There's still the Nigeria Veterinary Research Laboratory in Vaughan, human laboratory there, but they're also affected by some of these what I call the Nigerian factors. So many things are not as what we have the opportunity of having the Nigeria Field Laboratory Epidemiology training program, which is actually a showpiece of how, because it has a laboratory component. So, but it's a challenge, a good challenge that we pointed out how those organizations that human and animal, the laboratory can coordinate together. This is one of the challenges we're facing, and which we have recognized as one of the hindrances in Nigeria or obstacles. Thank you. Hello?
Thank you, Dr. Babalobi. And any additional questions will be forwarded to via email, and I'll also follow up with you separately about potentially doing a separate webinar where we could re-record for later viewing. So thank you very much for coming back online and presenting today.
Thank you so much. Thank you so much. Okay.
Thank you. Thanks, Jesse. We're going to go ahead and proceed with our presentation. So many presenters today have talked about university involvement and student involvement, and so I'm pleased to announce our next two speakers, Akil Gina from South Africa and Risa Pesapane joining us from here in the United States. So we have both sides of the Atlantic represented, I think, depending upon where our speakers are today. Risa and Akil, I'll just go ahead and open up both of your microphones. You all are ready to proceed. Thanks for being here today, and just let us know when we can advance your slides for you. Thank you. Risa, can you hear us?
I'm here.
Great.
Good morning. Akil is going to be kicking things off for us. Well, I'll go ahead and introduce myself. I'm calling from the University of California, Davis, where I'm pursuing a PhD in disease ecology. Specifically, my research interest is in how community composition and connectivity, either spatially or socially, influences microbial traffic or spillover. I joined the One Health Commission as a leader for Students for One Health in the summer of 2015, but I've been involved with One Health projects in the US and abroad for about 10 years now. And Akil is going to introduce himself. Akil?
Okay. Hey everybody. So my name is Akil Gina. I'm currently a veterinary student at the University of Pretoria in South Africa. So I've been involved with global student organizations on various forms for the last 5 years. And currently I'm a part of the OHC board as a student liaison alongside Risa and one other member, as well as being part of the World Veterinary Association's advisory group on zoonotic diseases. Currently, I'm still studying, but I've also begun a research proposal into the integration program for a primary health care facility for animals and humans within the Southern African context. I've also been involved with the creation of multiple One Health integrated projects between various disciplines within Southern Africa and globally. Risa, you're up.
So today we wanted to talk to everyone about the Students for One Health, and the SOH strives to be the largest unified body of One Health-minded individuals in the world. It serves as a conduit for sharing One Health-related knowledge, resources, and projects by creating a space for open discourse that overcomes our disciplinary boundaries. So the Students for One Health under the One Health Commission is thus essentially a communication gateway to a worldwide One Health society. Peter, can you advance to the next slide? So informally, the SOH is an international group of like-minded students interested in One Health, basically. It was formed because students wanted to be able to connect with each other and share their thoughts and experiences, give advice, etc. And there are many independent Students for One Health groups specifically, or similar groups that might practice One Health under different names, at different levels, and in different forms. They're at universities, high schools, global student organizations all around the world. These might be undergraduate students, graduate groups, regional clubs, and many more, and they all demonstrate the many scales of organization within the Students for One Health. So we are multi-level, and we are multi-stages of, or all at different stages of our careers. Momentum for our organization began in 2014, and in those early days of the group's formation, the One Health Commission sort of took the SOH under its wing. The OHC, being a leader within the One Health world already, understood and saw the advantages of having students involved within the One Health Commission. We're able to give new perspective to old and new problems within the OHC and the One Health world. And they also saw the ability to leverage their resources to help us connect as many groups as possible, both in the professional and student sphere. They also have a professional group for One Health. Additionally, there is the added advantage of connecting students and professionals for many reasons. So this network, this overarching Students for One Health, we're all linked by our desire to create an effective One Health society, if you will, that supports, educates, and facilitates future One Health professionals. Now, you don't have to just rely on the people in your immediate vicinity to develop your One Health skill set, but people all over the world are now in your One Health social circle. We can all work together and we can all learn from each other. And so that's what I mean when I say that we are built on social capital. Next slide, please, Peter. So currently the SOH has 3 members that are voting members of the One Health Commission board, and we also have 3 alternates. And these student leaders are all from different but important fields within the One Health world. They are currently human medicine, veterinary medicine, and the environmental domain, which is the one that I represent. Furthermore, these leaders, we all hail from all over the world, currently South Africa, Bangladesh, and the US, but could be from anywhere else in the future. So the OHC elected us from within the Students for One Health and making sure to represent all of the perspectives from the main pillars within One Health, to share the student voice to the board of directors and to contribute to the direction of the OHC formation and the future of One Health. So the relationship between the One Health Commission and the Students for One Health bridges this gap in what the students need or want and what's available in the world of One Health right now. We can request new educational materials, classes, knowledge of what opportunities are out there, ways to reach out to each other, and the One Health Commission can help us with all of those things. And in return, we help guide the Commission so that it's relevant to the needs of future professionals, and we use our skill set in social networking to help bring more people to this globally engaged society that is One Health. Next slide. So even though the SOH was unofficially created in 2014 and officially became part of the One Health Commission in 2015, our main project so far has been the creation of a base of highly motivated students with this fervent desire to change the world we live in by using the One Health concept. So we're still working on that right now, and I imagine we'll continue to do so. So we're currently utilizing listservs and social media to create this foundation, and in the coming years we want to be able to connect students through larger actions and programs like a mentor matching program. This might be peer mentoring, or it might be students matched with professionals. And so I want to stress that this would be a program that both professionals and students could be involved in, where local connections are enhanced and a viable long-term project can be created, assuring that the next generation will be ready to take up the role when the time comes. So over the course of this year, as like the first pilot year that there were SOH leaders, we've created this platform and structure from which subsequent years of SOH leaders will be able to create new projects that will further the knowledge and foundation, advancing the goals of the combined goals and cumulative vision of the One Health Commission and the Students for One Health. So we're building this foundation of members from which we can recruit future mentors and mentees. So if you're a student now, you will probably be finishing in the next few years, then you are SOH alumni and might be able to serve as a future mentor. And I'm going to allow Akil to take it away. Akil?
Peter, can you move to the next slide, please? Okay, so what is the value of the SOH? And it's been touched on very quickly by Risa, and I'm going to go into a little bit more depth right now. So we've spoken about the value to the OHC and what work is currently being done. In the One Health world, we generally fall into the flaw of doing a lot of research and talking in theory about the usefulness of One Health. But the SOH aims to change that. The SOH aims to make it to be more than theory and make it more than theoretical. We are students who want to see real action done with a solid outcome and proof of our work. That is one of the most motivating aspects of the student project, is they can actually feel, touch, and see the effects of what they're doing. We hope to not just hear about all the various possibilities of work, projects, etc., but rather turning these thoughts into the actions where we can have that tangible proof and create a larger group of students that can perform One Health projects. So in a very easy to understand case example of how the SOH is useful, Risa had a friend in vet school in Ireland interested in One Health, but she didn't know anyone in Ireland So she had contacted Cheryl in North Carolina and myself in South Africa, and together we managed to put her into contact with some people within the EU and the UK specifically that were doing One Health. In the future, we hope to create an even easier and more open channel of communications between students via the Listserv. That way students can find each other that are working in similar locations, and professionals can find students with a high drive to assist with projects, or students can find professors to give guidance on projects or research. We're hoping that by simple projects that we're able to get members of the One Health world to communicate easier. It helps to break down the silos we live in, to break through the circles of professionals that we normally associate with, and make a world where interdisciplinary communication problems are a thing of the past. We hope that these basic, small steps like opening communication, which are tangible projects, will be in the very near future the start to ensuring a quicker response to emerging threats, as mentioned earlier by Dr. Carroll. Peter, next slide, please. So,
sorry about that, Akil.
As Risa, no worries. So as Risa mentioned earlier, the SOH is not there to create more organizations, more student groups, but rather to assist and bring groups of students from a variety of professions together with the single desire of creating a better One Health world. We aim to utilize the energy at grassroots levels to move projects on a global scale where education, communication, and action are the main order of the day. There are global student organizations around the world representing millions of students, from the International Federation of Medical Students Association, IFMSA, to IVSA, which is the International Veterinary Students Association, to engineering student groups, to lawyer student groups, to pharmaceutical student groups. And as mentioned in the Global Health Security Agenda set up by the White House administration, the effect of having multiple groups from law, from medicine, working together is one of the key action plans. And we hope that by utilizing the SOH, we can actually advance the GHSA agenda. It is also very important to note that all of these organizations I've mentioned before, IFMSA, IVSA, the engineering groups, are already taking a very strong stance within the One Health agenda. With promotion of the One Health agenda through projects between these various organizations, such as days circling antimicrobial resistance, rabies, etc. And as recently as yesterday, IVSA, the veterinary students, the medical students, and the pharmaceutical students put out a statement regarding the importance of the One Health in the new world we are moving into. As the hundreds of students on our Facebook group from around the world, and not just in the Europe and the North America, but in Africa and Asia as well, that want to be able to communicate and interact with their peers from around the world, we also have thousands of students from across the globe that have energy and commitment that are signed into our Listserv, which we hope very soon will become a way of connecting to one another, as mentioned previously. SOH, through its members, hope to be able to interact and improve the One Health concept in every country globally. We don't look to have a top-down approach, but rather an approach I like to call the waterbed approach, where students and professionals with no positions within organizations giving advice to each other from around the world. We hope that through students we can saturate the ground levels with knowledge and projects that make a local, national, and continental impact. And an example of this would be medical students during the West Africa outbreak of Ebola, who took a big stance and helped through education of the Ebola in their Kick It Out campaign, which was recognized globally. Peter, next slide, please. So we've spoken about the aims and the projects of the SOH. We've said how we hope the SOH can really allow the students and the young professionals to connect with each other and really move forward projects and break down the silos of the professions we currently live in. But why is it important to the current professionals? Why should they invest their time? And the simple answer is because it is the future. This next generation is most important. This is the first generation of students to be educated in a time of awareness about One Health. The concept didn't take hold in academia until the early 2000s. This was also a time of great expansion in global connectedness through social media. And so students coming into programs now really are generally connected and generally see the world as an interconnected place. They understand these concepts inherently and can thus bring great insight to existing professionals who have had to learn that kind of flexibility later on in their career. They have the mindset and gaining their scientific toolset through training and training in the One Health way of thinking. One of the greatest aspects of students is their ability to be hardworking, dedicated members of projects who generally don't have other commitments, such as families, etc., that other professionals older generally do. They're able to work hard at odd hours to ensure that the project moves forward if they have the passion and they have the tangible evidence. They're the labor to any project, but they're not just a labor force that has knowledge that they have knowledge that ordinary people don't. The years in vet school, med school, engineering school, etc. has allowed them to think and comprehend projects like no other. An example is using them in an outbreak of diseases. Vet and medical students have knowledge of hygiene and disease controls, which makes them the perfect workforce for countering any outbreak and educating the public, as mentioned in the Ebola outbreak and the Kick It Out campaign. Students are the future. Their time will come soon, and the question is, will we stand passively or play an active role in their nurturing? Next slide, please, Peter.
So I want to sort of conclude with this call to action, asking everyone to join us. So if you're a student or a young professional, or you're just interested in One Health and you're listening to this webinar already, then we invite you to connect with us. There's many ways to do that. We have 2 Facebook pages. Initially, the Students for One Health was set up as a group page, and we also have it as an organization page now, so you can find us at either one. You can sign up for the student listserv on the One Health Commission site. So I have a screenshot here of the panels that you'll find on the homepage, and the yellow panel you can see is the Students for One Health panel, and there's a web page, and beneath that is the listserv sign up. So you can find us there. There's also the Student Who's Who in One Health, and we invite anyone who has an organization, formal or otherwise, to register their event on the Who's Who page, so that other students in your area could find you, or if they're looking to connect with someone in a faraway area, they can find you. So there's a number of ways to get involved now, and even if you're not sure you will want to utilize these connections, it's a great idea to connect with us now in case you ever do need to. And we hope, like I said, to be crafting the ways we connect them in the future to serve the needs of the community. So if you have questions and you want to connect with the student leaders, you can email Akil and I. Our email addresses are on the first screen of this slide, and you can also find more members of the One Health Commission, including our other student members, on the leadership page of the One Health Commission website.
So in closing, students are young professionals. They're the next generation of activists within the One Health world. And they are hungry. They are hungry for knowledge, hungry for projects, hungry for interactions, and hungry to change the world. The next generation has the ideas that can help reshape the world, the way we look at the world. It is upon us all, every one of us in attendance of this webinar, and those that you know that aren't interested in work in the One Health world, to help the next generation and share the knowledge that we currently have with them to help reshape the world. The numbers are there, the knowledge is there, and the time is now. It's time to take a more focused change within the educational structure as highlighted by the current One Health educational bill being drafted. Thank you.
Akil, thank you very much. Risa, thank you for the great presentation and again, keeping us on time. Jesse, do we have any questions in the queue for Risa or for Akil or about the Students for One Health?
Thank you, we do. It was a great presentation and quite a few questions coming in asking how people could get in touch and engage with the group, and so the last slide was well placed. There was another question coming from Michael Shacker. He asks, currently there is work being done in the development of a One Health certificate, which will be available in the United States during the trial year next year and will be available on a more global scale in the following years. Do you feel that the addition of a One Health certificate would be able to assist in both the larger incorporation of students into the One Health world, as well as act as a beneficial addition for students already firmly cemented in the One Health world?
Yeah, I would say that indeed we have many discussions about official certifications in One Health, and I think for a long time students sort of crafted these programs for themselves, either in the undergraduate level or graduate professional levels. So certainly having a program specific for that does eliminate some of the challenges and barriers that students might have faced to that task before. But I also would like to say that if that isn't available in your area, I certainly don't think that it is a requirement to be engaged in One Health and get a good education on One Health. You really just have to be more pioneering to do those things on your own if it's not currently available to you. But he's correct. There's a number of programs, both online and in universities right now, that specifically are being created for the purposes of training One Health professionals. Akil, do you want to add anything to that?
Yeah, I just want to add one thing that, like we said, that a lot of theory and a lot of talking goes along with the projects, and students and the young professionals, they want to see the action, they want to see the tangible. So having a certificate saying, yes, you've got this, you know, you've done this course on One Health is very useful. But one of the other additional benefits, and it's something that goes along with certificates and degrees like the MBAs, etc., is it's not really about how much you learn during this, but it's who you connect with, who is doing these courses. So if you look at it from that perspective and look at it as a place to actually interact with students from different professions and help break down those silos, you will gain a lot more than just the basic factual information such as infectious diseases that you are taught during these courses. That's what I just wanted to add.
Great, thank you very much. Pete?
Peter, if there's not another question, Cheryl would also like me to share with the group that the Students for One Health do regularly get together and have online meetings via webinar. And that's something that in the future more students could be involved in if they were interested in that. So, and also on the Facebook pages is a great place to sort of say, hey, how do you approach this, and what programs are available in your area, and how did you find mentors for your project, and things like that. It's a great place to ask those questions to the community.
Risa, are there any planned webinars currently or online meetings, and how would people, what's the best way for people to find that? Is it on the Facebook page, or is it on the, by joining the Listserv? What would you recommend?
I would definitely recommend joining the Listserv. That is where we push out weekly happenings in One Health from directly from the One Health Commission, and that list is populated by students sending in what's happening around the world in their area, and also where we directly communicate with students in the community. So we do plan on having a sort of student who's who in the new year, and the date has not been arranged yet, but that is definitely in the works. And so this would absolutely be a time that we would invite students to tell us about themselves and to learn about everyone else, and that the best way to learn about that is both through the Listserv and on the Facebook page. If you like the Facebook page, then these things will show up in your feed.
Fantastic. Thank you, Risa. Jesse, any other questions? We still have a couple minutes here if there's any further questions.
No additional questions. As I mentioned, there were a few about making connections, and we'll forward those on to the speakers as well.
Okay. Well, Risa or Akil, any further comments before we go to the break?
No, I'm good. Thanks for listening and joining in. Peter, well done on running this. It's been really top class.
Yes, thank everyone for organizing this and for everyone listening.
Thanks, Akil. Thanks, Risa. So that's all the time we have for this second session. We're going to take, let's see, probably about a 15, 20-minute break here, and resume with a presentation from Romania. Thank you to all of our session speakers and for our listeners for this session. Again, our next session will start in about 15 minutes. We'll hope that you join us back here. Thank you. Hi everybody, this is Peter Costa, just cutting in quick to let you know we'll be starting here in about 5 minutes. So take a break for 5 more minutes and we'll be back shortly. Thank you. Okay, everybody, we're going to go ahead and get started. Welcome back from the break. And we'd like to welcome new participants to the webinar that are just joining. As a reminder, as we enter this last session of the webinar today, all attendees are in a listen-only mode. Questions will be fielded at the end of each presentation. To ask a question, you'll simply type your question into the question box located in your webinar control panel as shown here. We'll be moderating the queue of questions and will help communicate your questions to the presenters. Also, please keep in mind, we're at the mercy of technology, so should there be a power outage or a loss of internet connection, we'll work as quickly as possible to bring the system back, and we'll proceed with the presentations as scheduled. If you're disconnected locally, you can reconnect to the webinar system by using the same access link that you used to join this broadcast. To our speakers for this third session, we'd like to say thank you for participating today. And given the agenda before us, we are asking each speaker to please adhere to the 25 minutes allotted for your presentation, and also to keep in mind that there may be a 1 to 2 second delay in the changing of your slides during your presentation. Our first presentation today is going to be from One Health Romania. Professor Manolescu and Dr. Supenu are the representatives from the leadership team from One Health Romania, and Dr. Supenu will be the representative joining us today from Bucharest. Dr. Supenu, give me just a second. I'll get your microphone open, and we'll go ahead and get started. Dr. Supenu, can you hear me?
Yes, I can hear you. Could you confirm the audio is fine?
Yes, we can hear you. If you could speak just a little louder, I think it would be perfect.
Okay, hello everybody. My name is Pano Alexandru. I am the spokesperson for One Health Romania, and on behalf of our entire staff who are here with me today, we would like to thank you very much for having us with you, for giving us the chance to present One Health Romania, who we are, what we are doing, what our plans are. And last but not least, a big thank you to the One Health Commission for putting this together. And we know it's a tremendous job you're doing, and we're really appreciative of it. So next slide, please. So One Health Romania is legally established as a non-governmental organization. We started One Health Romania in 2015. We're headquartered in Bucharest, the capital of Romania. In the short time since we've took shape as a non-profit organization, we have been recognized by the Romanian government as an association involved in strategical aspects of public health in Romania. Next slide, please. Our mission is to implement the One Health concept in Romania, and not only, we are very interested in participating in international projects and forming strategical partnerships with other One Health clusters. Next slide, please. So as to this date, we count over 100 individual members, and we're proud to say that we have members from all relevant expertise areas of the One Health concept. So we have human and veterinary medicine, environmental health and protection, food security, safety and nutrition, zoonoses and AMR, biology, physics and chemistry, engineering, economics, law, human and animal rights, clergy, social and art. Next slide, please. The other section of members, and we're counting this time the public and private legal entities, are also representative for the various domains of One Health. You can count environmental protection, food safety, security and nutrition, scientific research, the manufacturing industry, education, academia, NGOs, and human and veterinary medicine. Next slide, please. When we started One Health Romania, we've established a steering committee, as you can see on the slides, and we have 20 departments and each department is coordinated by a department director. And I'll skip detailing all the departments. As you can see, there are 20 of them, and they are representative for all sectors of One Health. Next slide, please. And another next slide, please. Okay, great. So internationally speaking, we are proud to say that we've established good relationships with the key One Health clusters, and we would like to take this opportunity to thank you for all the support you have given us so far with the One Health Commission, One Health Initiative, the One Health Platform, One Health Sweden, the Federation of Academies of Medicine in Europe, the World Veterinary Association, and the Universidad Autónoma de Nuevo León. Next slide, please. So, I was telling you that we established One Health Romania in 2015, and this slide is basically presenting a summary of what we have managed to achieve in little over 1.5 years. Next slide, please. So, besides the steering committee and the departments, One Health Romania is represented by our internal collaborators, and we're counting here legal entities, private and public, and the next couple of slides are going to be highlighting them. The first and foremost important collaborator so far is the Spirit University. It is the largest private university in Romania. Next slide, please. The Romanian Academy of Medical Sciences, the academia environment. Next slide, please. Romva Company, it's manufacturing small and medium enterprises that specializes in veterinary medicinal products, and recently has joined human health products. Next slide, please. The National Research and Development Institute for Food Bioresources. It's an institute that advocates for food safety, food nutrition, food quality, and in general a healthy lifestyle. Next slide, please. The Bucharest Institute of Oncology, and probably one of the most important centers of oncology in Romania. Next slide, please. The Victor Babeș Hospital for Infectious and Tropical Diseases, and as you can see, it was the first medical unit to detect the presence of HIV in a person in Romania. It's one of the biggest hospitals for infectious diseases in Romania. Next slide, please. Vanimed International Impacts, it's a manufacturing company that specializes in producing culture media and other innovative products from the field of advanced biotechnologies. Next slide. The Ovidis University in Constanța, it's one of the largest universities in Romania also. It's a multidisciplinary university. Next slide, please. We also have the Danube University in Galați. Next slide, please. We have the Alex Group, which specializes in poultry husbandry, farming, and slaughtering. It's one of the biggest producers of poultry in Romania, and it's a major exporter in countries like Holland, Germany, UK, Italy, France, and Greece. Next slide. The Military and Hospitaller Order of St. Lazarus of Jerusalem, which is a very important and dear organization to us. Next slide, please. The University of Agronomic Sciences and Veterinary Medicine in Iași. It's one of the oldest universities in Romania. Next slide, please. the National Forum of Comparative Oncology in Romania. It's actually the only specialized structure in comparative oncology in Romania, established in 2010. Next slide, please. The University of Bucharest, which is actually a leading academic center and a significant point of reference in society, one of the oldest universities in Romania. Next slide, please. The Romanian Federation of Zootechnics, it's a representative NGO for the farming industry and animal husbandry. Next slide, please. Rural Medical, it's a very important company specialized in healthcare. It has over 24 medical centers in Romania. Next slide, please. The Center for Biodiversity of the Romanian Academy. It's the leading organism and the major promoter of biodiversity in Romania. Next slide, please. The European Center for Education, Research and Development, Synthesis. They're one of our major partners when it comes to logistics, management, and organizing our activities. Next slide, please. The College of Physicians in Romania is the National Representative Association for Physicians in Romania. Next slide, please. We also have the College of Veterinarians in Romania, the similar association but for vet. Next slide, please. We have our central competent authority in Romania when it comes to veterinary and food safety issues. It's called the National Sanitary Veterinary and Food Safety Authority. Next slide. Okay, so we've shown you these slides to give you an idea of the efforts we're putting in to reach out to every significant part of One Health. And we're proud to say that so far we have managed to attract a lot of partners who are willing to collaborate in the One Health area. Our ongoing projects, we've drawn up a master's course. It's called Geodiversity and Environmental Risks in the One Health Context. It's expected to start in 2017. It's currently in the process of authorization from the competent authority. Next slide, please. One of our major projects is to unite national and international One Health resources under a mega One Health project. And for the next year, we've decided to focus on 4 key elements. The first one being emerging and re-emerging zoonoses from the Danube Delta, including a cross-border approach. The second project we're going to invest in is the identification, quantification, and monitoring of the potentially carcinogenic factors from the waters and aquatic fauna of the Danube River. Next slide, please. The third project is implementing the One Health concept into teaching activities at various levels, and starting from elementary level and ending up to the university level. And we're also considering the possibility of international study exchanges for students, because we really believe that education is a key factor for implementing One Health. And the fourth one is establishing the research center and the production facility, actually a poultry biobase for advanced immunology techniques, and having the purpose of uniting animal and human research in order to develop novel technologies and medicinal products for human therapies. So that's basically combining veterinary knowledge and production for the purpose of getting effective therapies for humans. Next slide, please. We're proud to say that we've managed to organize in September this year the One Health Interregional European Conference. Its main topics were environmental medicine, AMR, comparative medicine, food safety and nutrition medicine, comparative oncology and zoonosis. Next slide, please. We're proud to say that we had over 300 people in attendance and over 60 papers were presented. But the real success of this One Health conference was that we were finally able to find partners with whom we could use a common One Health language. We actually understood the needs and ways of operating of other One Health clusters, and we actually identified key points for future collaborations in the One Health area. Next slide, please. So we have a nice photo of the conference. Next slide, please. Another good thing is that we have managed to celebrate One Health Day yesterday. We engaged in a roundtable with the State of Harep University. We invited students. We've explained the One Health concept. We had a photos contest symbolizing One Health. And we really managed to get through to those students in explaining and getting them to understand what One Health is and how it can be used for personal purposes and for common purposes. Next slide, please. So the final slide is a message for collaboration. We would like to address all of you a serious message for collaboration. We firmly believe that One Health will only succeed if we put our differences aside and work together as a team. In order to do so, we will need to form collaborations, share our knowledge and our resources, as well as bring in any other One Health cluster in every single project that we develop. Next slide. And this is it. Thank you for having us once again, and we're really proud to be a part of the One Health international community.
Dr. Supanu, thank you very much for presenting on the impressive breadth and involvement of agencies across Romania, and of course for keeping us on time. In fact, we have about 10 minutes here. I'm going to go over to Jesse and see if we have any questions waiting in the queue.
Thanks. We've received one so far. Coming from Kane Shikawa. They say that they'd like to thank Dr. Supanu for sharing his One Health information on the webinar. They're wondering what was the key to creating such a well-integrated team in Romania so quickly, and were there any facilitator or communicators that were able to connect each sector?
We are basically a group of people that have known each other for quite a while, and each representing a specific field in the One Health cluster. So it was really easy when we finally got together and advocated for this One Health movement, because we all had our know-how, we all had our relationships, our professional experience, and basically it was enthusiasm and willingness to do something, to create a movement, to develop it, to invest in it. I must confess it hasn't been easy so far, but what we just showed you on the slides are actual results, and we'll hopefully next year in the next webinar we'll have even more to show you. And on behalf of One Health Romania, we would like to thank our president, Professor Manolescu, who has been a real guidance for us so far in contributing to the One Health international movement. If there are any other questions, gladly.
Absolutely. We have another question coming from Cheryl Stroud. She was very excited to hear about the One Health activities taking root in Romania. Can you elaborate on the One Health Romania's thoughts and plans for education of youth?
Yeah, we've actually managed to implement a pilot project with the Spiru Haret University, already mentioned the largest private university in Romania. We managed to get teachers that have embraced the One Health concept and who are working for Spiru Haret University to go over to kindergartens, to a specific kindergarten, and shape the toddlers' mentalities into understanding One Health at a very young age. So this, as I already told you, education is probably our foremost concern, and the area we're going to invest in most of our resources. So we firmly believe that if we want to have good results in One Health, education should come in the top 3 priorities.
Thank you. We have one more follow-up question from Charles Shroud, and along the same lines of the previous question, commenting again on how impressive and how fast the One Health Romania group was established. She had a question on if your members, how regularly your members meet, and how they can interact, how they're able to interact directly.
So we have a headquarters, a pretty big one, which can accommodate most of us. We were fortunate to find an adequate space. As I already told you, One Health Romania is governed by a steering committee, but the technical aspects are discussed, approached, and solved within the department. So there's a head of a department who basically summons the members of that department to a weekly meeting. We usually meet every week, sometimes more, sometimes less, and discuss practical aspects and how we should solve them, and fresh news, and and how we can contribute. So that's one of the most important aspects of One Health Romania, this organization of departments. It facilitates a lot, getting together and communicating and having results. Thanks, Cheryl, for the questions.
Thank you. Cheryl had one last quick clarification. She was curious when you mentioned the departments. Are those university departments or departments of One Health Romania?
No, these are actually departments of One Health Romania, but the members or even the department manager can be a representative of a specific university or academia member, or from the private sector, or even an NGO. Basically, these departments are coordinated by people who have had previous successful results in their field of expertise, who know how to coordinate a team and how to make things extremely simple. That's about it.
Great, thank you. Pete, do we have a little bit more time, or?
We do. Our next presenter may not be joining us for another 5 minutes. If there's any further questions, we can certainly cover them. Yes.
I had one question. If we're still waiting for a few additional questions to come in from anyone. I was curious if you mentioned one of your projects being the cross-border work for emerging and re-emerging zoonosis, and I was just wondering if you could give a little bit more background or details on your experience applying the One Health aspect to the cross-border surveillance issues.
I'll just give you one which I think is sufficient to get an idea. In 2007, we were badly affected by the influenza crisis, the avian flu, as they call it. And not being faced with a similar threat and real emergency situation for quite a while, we weren't that well prepared. And a large portion of the poultry population in Romania was affected. We had to cull most of it, and it was that example that made us understand that we actually need a cross-border, cross-disciplines approach in tackling situations that pose a real threat for public health. So, and another insight on the crisis of 2007 is that Romania hosts the Danube Delta Reservation. It's one of the biggest reservations in Europe. It's home to thousands of species, thousands of vectors, and although it's one of the most beautiful places in Romania, it's a real reservoir for emerging zoonoses, infectious diseases. So yeah, researches have been made over there, but it's that vast and that complex that it's going to take tens of years to fully understand the complexity of it and the biodiversity of it. And it's also very close to 3 other countries, so that was the aspect of the cross-border approach, because it doesn't only affect Romania, it can affect the other neighboring countries as well. I hope this covers most of your questions.
Thank you. Great. It certainly did. Pete, I think that's about it for the questions. I haven't seen any additional come in through the question or the chat window. I'll turn it back over to you.
Thanks, Jesse, and thanks, Dr. Supanu. And please thank Professor Manolescu also for this presentation.
Great.
Dr. Supanu, I will say we still have probably a couple minutes here. We're waiting for our next presenter. If you have any last comments you'd like to make, one thing we were wondering about is if you've been able to make any headway institutionalizing One Health thinking, at the government level in Romania.
As you well know, political situations are highly unstable. And most of the times the progress we make with a specific leader or specific political party doesn't apply to the next one. It's an international problem, as you very well know. We've been formally recognized by the General Secretary of the Government as an official organization that is involved in One Health and in specific public health aspects. And we're collaborating very well with the Ministries of Education, of Scientific Research, of the Environment, but I wouldn't go that far as to say that institutionalizing One Health is right by the corner. It's a very long way to go. It's a very difficult process, and as is the case of most countries, it's probably only going to happen after a major vector, a major organization will decide that it's time. I'm thinking here like the tripartite situation or whatever, We need a boost, and we're not the only ones. We'll be doing everything we can over here, but it's only going to happen once the trend and the general situation is heading that way. Yeah, baby steps at the moment.
Yes, thank you. So thank you, Dr. Supanu and Professor Manolescu. Our next presenter, Dr. Ab Osterhaus, is calling in, so please just give us a minute to see if we can get him connected into the webinar. Hi everybody, our next presentation is set to begin in 2 minutes. Please bear with us as we bring our next presenter in via the phone lines. Thank you. Hi everybody, thank you for your continued patience as we work to bring our next presenter, Ab Osterhaus, online.
Hello, this is Ab Osterhaus.
Hi Ab, this is Peter. Can you hear me okay?
Yes, I can hear you. Sorry, there's some problems with the connection, but I hear you clear and loud now.
Fantastic. So Ab, I have your presentation up on the screen with the first page being the One Health platform logo. So please just feel free to start whenever you're ready. Let me know when I can advance your slides, and since you may not be able to see the computer, just let me know if you need to stop and let you know where we are.
Okay.
Thank you.
So I'm starting. Can I start off?
Yes, please.
Okay. I'm starting off with the first slide, which is really introducing the One Health platform. We move to the next slide. It's about creating a healthy future for humans, animals, and their environments. When we move to the next slide, first of all, the motivation that we have to start this particular platform is really answering urgent needs and One Health needs. And that is, on the one hand, it's an integrated approach to combat different types of health threats like emerging and re-emerging viruses, antiviral antibiotic resistance, bacteria and parasitic infections. We have a shared concern and understanding that as transborder mobility of humans, animals, food and feed products increases, so does the threat of the spread of dangerous pathogens and infectious diseases. And we really want to do education and training of the next generation One Health experts and we want to create a framework for information sharing, detecting and mending knowledge gaps, and cross-sectoral cooperation. So the idea is really to focus on those things that are really not in the limelight too much, but which we really think deserve more attention. Let's move to the next slide. The mission that we have is really to have a strategic forum of stakeholders and a One Health reference network that aims to enhance the understanding of and the preparedness for the current and future outbreaks of zoonosis, but also emerging infectious diseases in humans and animals alike, and antimicrobial resistance, including the ecological and environmental factors, so the complex mix of predisposing factors which impact on these diseases. Next slide. Obviously, we have set ourselves quite a number of objectives, and it looks a little bit boring, all this text, but I'm afraid I need to go through it to give a better understanding. We want to provide a strategic forum for researchers, but also early career investigators, governmental, non-governmental institutions, international organizations, companies, to foster cross-sectoral collaborations. Identify and prioritize the research gaps in the fields I just mentioned. And again, we're really dealing with the gaps. Yeah? So things that we think are really not sufficient in the limelight and need more attention. We want to create synergies and facilitate the sharing of data between researchers and our research group in order to mend those gaps that we have identified, and to translate the novel data to anyone who might benefit from them, including all our stakeholders. Next slide. We will coordinate global research and disseminate the results and insights of existing and new research projects on zoonosis, emerging infectious diseases, and antimicrobial resistance, including the predisposing factors, the ecological and environmental factors which impact on those diseases. We want to establish an information reference center for the One Health community, and we want to enhance awareness amongst the stakeholders and especially address the non-believers, so to say. We realize that this is largely supported by groups of veterinarians, but we want to get more and more also the medics on board, which we are quite successful in at the moment, but also other disciplines that are essential for fighting this combat. The next slide is really dealing with our structure. So our structure, you see on this slide, the different activities and groups that we have: early career research circle, supporting partners action group, editorial board, One Health platform, supervisory board, and One Health coalition. I'll go into them. First of all, the structure. The management board is Chris van Langenonk, who has had a lot of contacts with you, Professor John McKenzie, he's from Australia, and myself. And so we are really doing the day-to-day management, and we all have quite a long history, John and myself, in One Health, having organized several meetings, but also a lot of activities in the field. And Chris van Langenonk has a lot of experience in data management and communication. Supervisory boards, next slide. There's really key experts representing their respective disciplines. As much as possible, we have people from as many different disciplines as necessary, from both genders, and well over distributed over the world. So we are not a European group, we are not an American group, we are a group operating worldwide. Next slide. Our patron and honorary board member is Peter Doherty. He is the first and only veterinarian to be awarded the Nobel Prize, and he is really an advocate. It's not just name dropping that we do. He's quite active in the field and comes and speaks at our meetings as well. Next slide, you see the active supervisory board members, apart from John and myself. David Heyman, so you see all the names there, well spread, well introduced in the respective areas, and really experts in those areas. Also, we have people from Africa, from Asia, from the Americas. On the next slide, the other supervisory board members, well, people like Rita Colwell, Liva Wang, Mark Riawamu, Eddie Holmes, Tom Mona as well, all names that are quite well known to people in this particular field. The next slide, we have the early career researchers circle. We put a lot of emphasis on the young scientists. So we have Leslie Rupperer. She's the postdoc from Princeton and from Rotterdam, and she has organized a lot of activities in this particular area, including organizing meetings, but also being very active in organizing people to get scholarships, awards, and networking. Next slide. We have the Supporting Partners Action Group, which is a working group of partners and donors. Theo Canelos from Zoetis, from industry. He is the focal point there. We are working on a focal point from the medical field. We have somebody who's probably going to join. He needs still approval from this major company, international pharmaceutical company. So we have the International One Health Coalition, which is a structural partnership with international governmental and non-governmental organizations and institutions. And we aim to reinforce the One Health concept by creating synergies and collaborative relationships. On the next slide, you see the groups who are on board in the meantime. This is our International One Health Coalition. These groups have all scrutinized our articles of incorporation. So you see different One Health groups from all over the world, different professional groups. Chatham House is on board, Fondation Mérieux is on board, the One Health Commission, the World Veterinary Association, the World Medical Association. On the next slide, you see that we have ad hoc collaboration with WHO and CDC, and the expansion is ongoing with FAO, OIE, GLOPID, ITSA, so several other organizations that currently the billable indicators that are looking into at the moment, looking into our articles of incorporation at the moment. We exist for a year now. We have organized a lot of things, and we are getting more and more groups on board. The supporting partners, the One Health platform really needs the collective expertise and knowledge from international not-for-profit and funding organizations, EU research projects and academic institutions, but also corporate supporters, which is basically pharma and diagnostic industry. Next slide. Activities that we have. We have, first of all, the biannual One Health conferences. There is a conference we have organized in the past, the meeting in Amsterdam. Subsequently, before that, there were two other meetings that John McKenzie basically organized initially in Bangkok and in Australia. And the next one is going to be in Australia, and that will be in December now. We are co-organizing that, but the subsequent one in Saskatoon in 2 years, that one is going to be organized completely by the One Health platform. Well, we have a scientific program based on the One Health research agenda, which is approved by our supervisory board and being discussed extensively. We have a separate science policy interface track for public health officials and decision makers. And so as you see at the bottom, the 4th edition is in Melbourne, and the subsequent one is going to be in Saskatoon. Other activities that we have an annual supervisory board meeting where we get all those people you have seen, we get them together. Annual General Assembly meeting where we get all the stakeholders together. Yeah, and there the research agenda and all the activities that we are doing currently are being discussed. So we have, yesterday was for the first time, on the next slide, was the One Health Day, the International One Health Day. That was organized by the 3 organizations that you see here, the One Health Platform, the One Health Commission, and the other One Health group. You see, we have organized a lot of activities. It's being bundled at the moment. Was for the first time. We focused largely on young people, young groups of people who actually brought a lot of activities together. We're going to give a summary, and the International One Health Day on the 3rd of November. Quite important. Put it in all your agenda just to make sure that you can be part of that. Next year, this year it was already an enormous success. Other activities that we have is the One Health Day campaign. So that you see that here. That's basically what's the thing I just alluded to. If you go to the next slide, define other activities, define, initiate, and coordinate scientific research projects with regard to the implementation of the research agenda. We will ourselves, obviously, given the limited funds that we have, will not be a funding organization ourselves, but we are committed to facilitate research, the acquisition of research projects by young scientists, and being involved in a lot of international research consortia and coordinating research, and perhaps more importantly, disseminating the data of the research. Well, on the next slide, we built on the collective expertise and knowledge of our partners. It's dedicated to the use of the knowledge to benefit the One Health community by, on the one hand, providing ad hoc advice to international foundations, national and international governments, governmental institutions, and other non-for-profit organizations, and also by creating an ad hoc and structural synergy with existing organizations. So we are not competing with other organizations. We are more like an umbrella organization to develop and implement a joint agenda, or to mutually support and strengthen the respective agendas. As you will have seen from our supervisory board, there's people from all kinds of different One Health organizations present. So we disseminate a lot of the information there on the next slide, dissemination tools. We have the onehealthplatform.com, which is a portal to collect and disseminate information on the One Health at all levels and all aspects. We have a newspaper that we print, a physical hard copy newspaper that we distribute at meetings. We have a database of global One Health actors, and that's quite an interesting thing. We have some 15 to 20,000 people who are affiliates of the system through the different organizations we work with, and we can very, very fast send out ad hoc electronic news flashes to bring highlights and alerts into the world. Next slide. We have a One Health journal. We started that after the meeting in Amsterdam last year. Quite successful. In the meantime, we are going to have our impact factor this month, already after a year, and it's an Elsevier journal, open access, a unique multidisciplinary journal based on the recognition that human and animal health and ecosystem health are inextricably linked. And well, we get in a lot of submissions. We have to unfortunately reject quite a number of lower quality papers, but we're doing actually quite well there. Well, and then the last slide that we have here is the benefits for supporting partners. So we are working with all kinds of supporting partners, but also with industry, as I've pointed out. We have, in the meantime, some six big industries on board who we collaborate with, and the benefits for them is that they basically benefit from the One Health agenda of the platform, and it can regularly interact with the supervisory board members. They interact with the community by attending the annual meeting of the One Health Platform Supervisory Board and the coalition partners. They have readily access to extensive multidisciplinary and scientific expertise of the whole network. We have developed and are developing in One Health action groups. We organize very specific meetings in close collaboration also with the stakeholders. We provide relevant content and announcement to be shared via the Open Health platform and the onehealthplatform.com. And so the supporters, they act as privileged partners and receive a discount on the sponsor opportunity. We think very, very importantly that also industry is an important stakeholder. When we are talking about diagnostics, vaccine development, antiviral development, antibiotic resistance, we cannot do that in isolation, and we need governmental, non-governmental, but also organizations, but also the private sector. So I think this was more or less in a nutshell what I had to tell, Peter. So I hope it worked out.
Yes. Yes. First of all, thank you for joining us, and that was a ton of information in a short period of time. So thank you for the overview and the breadth of information. I believe there probably are a couple questions. If you can stick with us for just a few more minutes, Jesse.
That's fine.
Thanks, Pete. Yes, we're starting to have a few questions come in. The first comes from Joanne Lindemeyer. She asks, can you give some specific examples of achievements of the One Health platform?
Well, very specific achievements are, first of all, the meetings that we organize and co-organize. So that those are the international meetings. We are working on the second one, and that it works already. So the dissemination tools, they're up and running. that includes also the journal, which is online. It's an open access journal where which is a high quality journal. We also organize on request, and we are doing that as we speak, meetings on very specific subjects in close collaboration, for instance, with industry as well, but also with other stakeholders. So there is quite a lot of activities that are in the pipeline and that have already materialized. Does that answer your question?
I believe so. We have another question following up on that. Can you tell us what the involvement of students is in the One Health Congresses?
What the students, the involvement of students?
Correct.
Yeah. So what we have the early researchers career. So on the one hand, we are in the process of organizing, together with the two other organizations I mentioned, is the One Health Day, and that the One Health Day was really an organization where more than 100 different groups worldwide have actually organized in their respective settings. We usually university setting a One Health Day, which is basically a day where a number of presentations from in the respective premises were being given. That's one thing. We also we very actively interact with young people to actually encourage them and help them to write project proposals for European projects, for US projects. So that means really with the experience we have in the supervisory board, we have people dedicated to young scientists that we have identified that we encourage them to write project proposals. So they are at the level of young postdocs basically and late PhD students, really to teach them and to help them to really profit from the knowledge in terms of project writing that's present within the supervisory board. We and the supervisory board, we are all sitting on those evaluatory committees, and I think for young scientists it's quite important to learn the do's and don'ts and the tricks to write project proposals and to get funding in for their research areas. Over.
Great, thank you. We have a follow-up question to the previous question about specific examples of achievements. They were particularly interested if you could give information on what the action teams are.
Well, in the structure I've shown you, let me see if we can find it. So we have the International One Health Coalition. That's one team where we have all the different organizations. With those groups, we sit together regularly to actually have to fine-tune our action plan, and that means we have a 5-year action plan, a strategic plan, and the annual plans are being honed every year with that international coalition. We have the Early Career Researchers Circle, which I've just alluded to. Then we have the Supporting Partners Action Group, which is a very active group where also industry is quite active. It's firewalled from the other groups, but there is quite some interaction. We have an editorial board for the One Health Journal, so that means that really the One Health Journal, we involve young people. So one of the editors there is Leslie Rucker, who is a young postdoc actually from Princeton, and she is very active also in helping eliciting papers to getting good papers in, both review papers, but also papers from primary research data. So that's an active thing that's ongoing. And we have, of course, all the activities with the supervisory board, and the supervisory board is extremely active. Again, it's not name dropping. We have really at the daily basis and definitely at the weekly basis interacting with people of the supervisory board, who each of them they're very active and give input into the activities that we initiate. And perhaps it's good to say many of us are being invited. So I'm now here today. I'm in Vienna in the IMET meeting. I gave the first introductory speech at the meeting, really to highlight the importance of the whole One Health idea, and really bringing on board as many and convincing as many as possible young scientists, young people, that this is definitely an area to go into. Giving the example, for instance, I myself, I started off as a field veterinarian and then went back doing a PhD. and then explain in which different outbreaks we have been involved and where we have discovered the virus and have helped to make intervention strategies. So, and that kind of knowledge that can well be implemented in also all the project writing. Over.
Great. Along those same lines, a person asked, particularly along those action activities, the policy track that's attached to the semi-annual conference. And they're interested to know how that interacts with scientific presentations.
Yeah, I was a little bit brief on that. It's actually one of our success formulas. So we have developed that in the past together with Chris van Hendonk. Who's really a strategical person in the field of communication. And so what we did is that we organized the big meetings in Flu, for instance. We organized the World Conference, the European Conference, and in doing so, we realized that we always had together a group of world-class scientists, who were really the absolute experts in their field. And so what we have gradually developed over the past 10 years is a system by which we, during a meeting, especially the meeting, so like the meeting we are organizing now for the next edition in Saskatoon, there will be basically 4 tracks. There's 2 emerging infection tracks. There's 1 antibiotic resistant track that runs through the whole program, and there is the so-called SPI track, the Science Policy Interface track. And what we do there is, rather than giving dry lectures by top scientists for non-experts, so to say, the non-experts we are targeting, they are basically policymakers. And so policymakers, we have a list of a couple of hundred policymakers from all over the world who really make real policy. That's at the level of directors general of ministries and the direct staff. Yeah, we are communicating and working also with some members of the European Parliament. And so we bring together at a meeting like that for the 4th track that is always running in parallel. So we expose those 200-300 people. We cap it at 200-300. Yeah, and then those people, we expose them to the top-class scientists and we ask the scientists then to, world-class scientists, we ask them to just give a 10-15 minutes presentation, after which for half an hour the policymakers can ask all the questions they need to ask and the things they need to know. The problem with those policymakers is that generally speaking they have to cover such a vast field that they cannot be experts in all these different areas. So we bring them on board, and then actually they can ask, and we use basically the Chatham House rule that anything that's being said within that setting will not come outside. So that means that they can ask whatever question they like, and this has really direct impact also on their policy making, because in this way we are able to very efficiently bring all the important things to the people who need to know for policy making. So it's not politicians proper, but it's really the people who advise the ministers. So it's basically at the level of DG and their direct cabinet. Yeah, so meaning a director general of a ministry or of a commissioner in the European Commission. So they come to the meeting, and as a matter of fact, they learn what's going on, and they can translate that directly into policy making, really on the basis of facts, on the day-to-day facts that they're facing and the questions they are facing, and then they're being given the answers from the top scientists. Yeah, so that means very simple questions like, for this and that disease that's emerging, do we have a vaccine? Are we going to have a vaccine? Do we need a vaccine? Is there other means of doing that? Look at Ebola. Yeah, so do we need a vaccine? Did we need a vaccine? Why didn't we have a vaccine? Did we solve it with or without a vaccine? Why did we solve it without a vaccine? Why is it that 13,000 people died? And well, these kind of questions, and how can we be doing better next time? So that's typically in the SPI track what's happening. And the interesting thing is that the policymakers, they actually ask us if also outside the meetings that we do, so these general meetings, if it isn't possible to, in between, to organize some of these meetings as well. Of course, it's very difficult to get all the top-class scientists then together, but for very specific things, we do it anyway. Over.
Thank you very much. That was a great response to all the questions, and I think that's about all that we've had submitted. I'll turn it back over to you, Pete.
Thanks, Jesse, and thank you, Dr. Osterhaus, for joining us today. And we were glad we were able to connect you via telephone. Thank you very much.
Okay, thank you very much. Okay, bye-bye.
Okay, thank you. So we're now going to turn the presentation over to Dr. Douglas Freeman. Dr. Freeman is at the Western College of Veterinary Medicine at the University of Saskatchewan in Canada. And Dr. Freeman will be talking to us today about a student-based approach to building One Health. Dr. Freeman, give me just a second. We'll get your mic open and your presentation ready, and we'll go ahead and get started. Dr. Freeman, your mic is now open. You can proceed whenever you're ready. Just let us know when we can advance your slides for you. And it looks like you might be self-muted, so you should be able to go ahead and start your presentation.
By you.
Dr. Freeman?
Nope, there we go. Peter, can you hear me okay now?
I can, loud and clear, thank you.
Fantastic, thank you. Well, thank you everybody for hanging on to the final presentation. I have to admit it's a bit daunting to follow such a great group of speakers, including those exceptional students. And I have to say it's been an amazing array of presentations, particularly demonstrating significant current impact. And my talk will be a little bit different, and I'm really talking about future investment. And so it's great to be here today, and I'd like to thank the One Health Commission organizers for inviting me to participate. I'm going to focus today on a program at our university called the One Health Leadership Experience, and as Akil and Risa both noted, students are the future, and that's been the focus of this exercise. But I'll start by just briefly talking about One Health on our campus as a backdrop. So if you go to the next slide, please. At the University of Saskatchewan, One Health is an important area of focus. We're the only Canadian university with really the full complement of health professional colleges and schools co-located on the same campus. So that does give us tremendous opportunity. The university a number of years ago defined 6 signature areas, or areas of preeminence, and One Health is one of those 6 signature areas. We're also home to 2 national level laboratories. The Canadian Light Source is Canada's only synchrotron, and it has a very unique biomedical beamline where we can image live animals. And then VITO Intervac, the Vaccine and Infectious Disease Organization International Vaccine Center, is a research center. The International Vaccine Center is the largest biosafety level 3 large animal facility in the country. So we have some amazing resources, again, opportunities to work with. Next slide, please. Some of the One Health related initiatives on campus include a graduate certificate in One Health, and that is organized through our NSERC funded, so that's a federal funding agency in Canada. ITRAP program, that's an integrated training program in infectious disease, food safety, and public policy. And so graduate students from a wide variety of programs can take the core certificate courses and combine it with their own courses for an official certificate. We also have One Health postdoctoral fellowships and the One Health Leadership Experience, which we'll be talking about today, and a variety of platforms for collaborative, interdisciplinary, and interprofessional research. Next slide, please. We also have collaborative undergraduate research programs, summer scholars programs, and so forth related to One Health, and an official undergraduate certificate in One Health. So students from various majors in undergraduate areas of study across campus can again take a core group of courses added to their own area of study and have an official certificate appear on their transcript in One Health. Our Arts and Sciences College has a bachelor's degree in health studies, and as Ab noted, we're very excited to host the 5th International One Health Congress in summer of 2018. So invite everybody tuning in here to come visit us in Saskatoon. Next slide, please. I think like everywhere, we struggle, even being a campus with all these co-located health professionals colleges, we struggle with silos and a kind of history of kind of working within your silos. And in some cases, health professionals are trained to work in their silos as well. And there's a reluctance for today's leaders to meet and work together. I'll share a story with you. Our former Dean of Medicine and the 5 veterinary deans in Canada spent 3 years trying to get collectively the medical school deans of Canada together to meet with us, and we're ultimately not able to generate that interest. So there's a ways to go. Our solution, one part of the solution anyway, is to focus on students who are going to be the change agents and tomorrow's leaders in One Health. Next slide, please. So that was the initiation of the One Health Leadership Experience. We have been doing this for 5 years now. It's an annual workshop for U of S. Well, it began for the health professional students. We targeted first year and second year incoming health profession students for a weekend-long workshop the weekend before classes start. It has, however, expanded, as it should, include students in agriculture, law, social work, arts and science-related areas like psychology, and our environment sustainability programs. We've also included participation in graduate students in various health science-related programs as well. Next, please. So the concept is it's an introduction to key One Health concepts. We begin on Friday night, and it's an intensive program all the way through till midday on Sunday. We've invited leaders in One Health and presenters from across North America and actually beyond now. Liz Mumford from the WHO in Geneva was one of our speakers this past August. And the format is after an introductory engagement on Friday night, and we actually print up business cards for each of the students with their name and email and college on it, and encourage them to exchange those cards throughout the weekend with the students that they meet from the other programs. And then Saturday morning, each of our invited guest leaders will give a presentation on One Health in their particular area of expertise. In the afternoon, we break everybody up into small groups and go through One Health case studies with our guest leaders and campus leaders, and then have some socializing and One Health trivia Saturday night, and then Sunday morning the focus of the presentations and then the small group workshops, small working groups, is on leadership skills. The ultimate idea is that as students go through the program, they gain an understanding of the principles of One Health, get some leadership tools, and build connections across disciplines amongst themselves, and then launch their studies hopefully as a cadre of change agents for One Health in their colleges and programs. Next slide, please. Since it is a learning program, we have learning objectives. You can see them listed here: understanding the definition, basic concepts of One Health, be able to discuss functional connections between animal, human, and environmental health, recognize the role of interprofessionalism and safe and progressive practice of the health science professions, develop a connection with students from other health science colleges and schools on campus, and I would really, again, like to highly emphasize that aspect, and to appreciate methods of opportunities to become change agents for One Health in your respective schools. Beginning on day one, before they even get immersed in their own programs, to build those connections across the professions, we think is one of the key objectives of the program. Next slide, please. And so this is just an example of issues that everybody on the call here and beyond could certainly come up with as well. Animal-assisted therapy, antimicrobial resistance, prudent use of antibiotics, medical errors related to lack of connection, communication between health professions, emerging zoonotic disease, translational research, disease surveillance, healthcare-associated infections, team-based practice, food safety and public health, and professional collaborations are all areas we try and address throughout the program. Next slide, please. And of course, we gather feedback every year, and I just wanted to share this comment from one of our students from College of Pharmacy and Nutrition. If you form those connections while you're learning and growing together, then once you get out into practice, you'll be second nature to reach out and work together. It was incredibly rewarding to have a student feed that back to us following her weekend in the One Health Leadership Experience. Again, that's a key objective. Next slide, please. So we've had just an amazing array of truly inspiring speakers that have joined us, and just to kind of mention a couple of highlights. Dr. Andy McCabe talked to the students about wicked problems and how solving wicked problems relates to solving issues around One Health. And wicked problems are those complex, very difficult to solve problems. They're often contradictory, or have changing requirements. Interdependencies and wicked problems often mean that when you solve part of it, you actually open up a new problem to address. So he kind of walked through what wicked problems are and how to relate that to One Health. Frank Serra from University of Minnesota talked quite a bit about their Center for Integrated interprofessional practice and education. That is a great clearinghouse of information if you haven't gone to their website. Next slide, please. Liz Mumford was with us this past year from WHO. She talked about using cross-sectoral approaches to addressing health risks at the human and animal interface. And I have to admit, when I've been engaged in conversation around the tripartite agreement between WHO, OIE, and the FAO, I come back to campus and think, if three organizations in three different cities in three different countries can figure out how to connect and work together, our colleges on one campus ought to be able to do it as well. So somehow it seems like it should be less of a wicked problem. And Brian Evans, Dr. Brian Evans was with us in our first two One Health Leadership Experiences and talked a lot about the global reach and transmission of infectious disease agents, as many of our speakers today have talked about as well. Next slide, please. We've had a variety of folks from the CDC that have come and participated. Next, Dr. Casey Barden-Baravish in the picture there. She's a captain in the U.S. Public Health Service, and she's the head of the One Health office in the CDC. But each of these speakers have brought their own history and perspective to One Health, primarily approaching various disease outbreak investigations, particularly around food safety outbreaks as well. Next slide, please. Dr. Barbara Natterson Horowitz is a cardiologist at UCLA, and she's the author of co-author of the book Zubiquity, and one of the founders of the annual Zubiquity conferences. And if you've never attended one, they're very very interesting. And she focuses quite a bit on the interconnection of human health and veterinary health, animal health. And talked about collaborative healthcare resulting in better knowledge, treatments, patient outcomes, etc. But one of the things that she said in her talk that she really emphasized to the students, and it's come up a number of times, and I've thought about her discussion as I've listened to the presentations today, is she really emphasized to the students that One Health is more than just infectious disease, and talked about some of the disease issues that humans and animals share, including cardiac disease, obesity, and even self-harming behaviors that are non-infectious. And so that was a really good reminder from her. Peter Rabinowitz, co-author of one of the seminal One Health books, had great discussions with the students, talked about integrating One Health into human medical practice. And I remember in particular one example he used of a patient showing up in the ER with chest pains, and kind of walked through the human health aspects of working that case up, but then brought in a layer of animal health related aspects and then environment related aspects as well. Next slide, please. Dr. Kate Hodgson has been a wonderful contributor to the One Health Leadership Experience and other programs on campus as well. She's a veterinarian, but she works at the University of Toronto Faculty of Medicine and publishes on the positive impact of pet ownership on human health risk factors, including positive impacts on cardiac disease, obesity, and even things such as community engagement and the isolation of chronic disease. And she's doing research right now into what she calls a pet query, and works with primary care physicians, has data to show that if they ask their patients about pet ownership, it actually opens the door to getting quite a bit more information about that patient, about the home environment, and builds a stronger relationship between the physician and their patient, and a stronger what she calls therapeutic alliance. So interesting stuff there. Jessica Borg-Smith came to us from the Mayo Clinic in Rochester. She's part of the Department of Integrative Medicine. She's a veterinary technologist, actually, but is involved with their animal-assisted program there, and talked about the role and the value of pets visiting patients who are at the Mayo Clinic. Next slide, please. Colleen Dell is a Centennial Enhancement Research Chair in One Health and Wellness at the University of Saskatchewan. She's in she's a co-appointment in the Department of Sociology in the College of Arts and Sciences and in the School of Public Health. And she has taken her dogs through service dog training and speaks and does research on the use of animals in working with people struggling with substance abuse and other issues. A lot of her work is also with indigenous populations. So it's really amazing stuff coming from Colleen and her group. The other person pictured there is Rick Yount. He's the executive director of the Warrior Canine Connection outside of Washington, D.C. That's one of his service dogs, Huff, there with the students. And he has talked about animal-assisted therapy in working with veterans in recovering from or managing post-traumatic stress disorder and that type of thing. But what another really interesting aspect of his program is they enlist veterans to train the service dogs for other veterans, and have found that process of learning how to train a service dog for other veterans is actually therapeutic and helpful for the trainers as well. Next slide, please. As I mentioned, leadership has been an important part of the program. We typically will have a speaker focus on leadership. The person on the microphone there is David Dubé's, CEO of an international group and based out of Saskatoon, actually, a local philanthropist. And he had some great comments this year for the students, talking about as a leader, you shouldn't have to motivate people. It's your job to inspire them. He also talked about knowing when it's time to lead and when to follow and so forth. Lonnie King talked about a lot of One Health issues, but also leadership and One Health leadership competencies that they had articulated at the CDC as well. So things such as being able to lead change, being a strategic thinker, vision, team builder, dealing with ambiguity, collaborative, interpersonal skills, and so forth. Next slide, please. So what are some of the outcomes so far? One was the formation of One Health Club, and actually in the very first year, several of the speakers donated their honorarium to help start up a One Health Club, and two of the government-related folks provided a fund for undergraduate research, a submission, team projects that came out of that. We've seen between the health science. We've also had to help here by helping to host One Health panel discussions. We had a variety of interesting evening programs. Last year we had a panel on antimicrobial resistance that was so well attended we actually had to find at the last minute a new venue, people from the health professions as well as veterinary medicine research. And in our area, a 1 hour of continuing education in antimicrobial resistance for our veterinary licensing renewal. And so we actually had quite a few and physicians attending that panel as well. It was great to we had panel discussions on the environment related to One Health and biosecurity. So we've nudged things along to get together as well. Not only just funding and so forth, food to help bring the students together. Again, focusing on more learning opportunities at the undergraduate level, and on Jen Nyhoff, there she's a student in veterinary medicine. She was in the first One Health leadership experience, and I think every single one since then. After the first year, she actually created her own video describing what One Health is, and if you go on YouTube and search Jen Nyhoff, you'll find her her video on One Health. It's really well done. She was our student leaders on campus. She graduated last spring, and she was actually offered an opportunity to do postgraduate studies at global health by one of our former speakers. She really struggled with that offer, but down she had planned on going back into private practice in a small town in northern Manitoba, and I know that at least to start her career, I would be very surprised if she didn't go on with some other things, but I'm quite certain that that Manitoba town will be seeing One Health practiced in their community. Next slide. Next slide, please. Oh, there we go. Thank you very much. Some other things have sort of been happening kind of related to One Health. I think some connections have been built through faculty participating in One Health leadership experience. We've got a very engaged veterinary social work program. It's a partnership between the vet school and the faculty of social work at a neighboring institution, University of Regina. The vet school has a service learning program where we go up to northern indigenous northern communities that has no veterinary care available and do remote spay-neuter clinics, but it's a great opportunity to serve as a platform for colleagues in the College of Medicine and in the coming year, School of Public Health and so forth, to partner with us. We have various research programs with those communities related to One Health, for instance, looking at parasite load and transmission between dog populations, wildlife, and people in those communities. So the sum total of all that is really it's a partnership with those communities, and that sense of partnership and working together is very important. Next slide, please. Next steps for us and for everybody across campus is, again, continuing to try to work to engage outside of our silos. training the next generation in the necessary skills to promote One Health, interprofessional education, experiential learning, and I do have to say, I mean, the One Health leadership experience has been a wonderful start for us. But again, that breaking down those silos, even with curricular issues and things like that, with interprofessional education, it's not easy, even when you're co-located in the same building or on the same campus. There's lots of focus on those non-technical skills and aptitudes, the communication, interpersonal skills, and so forth. Trying to move One Health from isolated projects into the mainstream, keep developing new funding models to support One Health. And now that we've done our One Health leadership experience for 5 years, we're in the process of doing a fairly extensive study with past participants, looking to identify the measurable outcomes from the One Health leadership experience, and hopefully then share that in a formal publication with others as well, and gain more feedback. We have heard from our speakers that have come from various places around the world that it's one of the largest student-centered programs related to One Health that they've seen, and it really is focusing on students. And so if anybody listening today sees any gaps in what they think our approach is, what we're doing, we'd sure love to hear a comment from you as well. I have to say, well, next slide, please. And wrapping up, it's been students really are the change agents on campus in their professions. One of my colleagues used to say the world is run by those who show up, and so we always commend them for showing up, and we describe, I guess, what we're trying to do is as a relay race. And if you're taking pictures of a relay race, there's always one frame where there's the runner who's just finishing their lap, getting ready to hand off the baton to the runner who's just starting their lap. And that's the picture we try and give the students, that we're in the process of passing the baton back to them. And I have to say that for myself and others, the One Health leadership experience has really been inspiring. It's fun to see the students and how inspired they are as they finish the weekend, and we always hope that they can kind of keep that fire burning as they get embedded in their very busy and rigorous study programs. But what's really been interesting is our speakers who join us are also inspired by the group of students that show up and I think are going to be the future agents of change. So if there were sort of two key points that I might leave the group with here as we're wrapping up, one of them is that the students are going to be the change agent. There's ubiquity. Classes that I went to, one of the last speakers was at that time president of the Institute of Medicine in the National Academies, formerly called the Institute of Medicine, the National Academies, and I shared with him the story of us trying to engage all the medical school deans in Canada, and I asked him, what can the Institute of Medicine do to help physicians understand that they should, it's worth their time to engage with veterinarians and others. And his response to me was, well, Doug, it's probably sacrilegious. He said, but it's students. Students are going to be the change agents for us. So that reinforced for us the One Health leadership experience and the approach there. The second thing I'd just like to add is that One Health really is not just infectious disease. There's a whole range of areas that we need to be engaging with around in One Health to promote health and wellness. So with that, I will say thank you to everyone for your attention, and thanks again for inviting me to participate.
Dr. Freeman, thank you. That was a great, fantastic presentation. And, it's always wonderful to hear about these kind of opportunities for students, the leadership experience, how strategic and intentional it is, and being able to leverage the co-located colleges. Fantastic. Now I know that we do have a couple questions, so I'm going to turn it over to Jesse. Thank you.
you, Pete, and thank you for a great presentation. We do have a couple of questions. The first two are actually related to one another, and so I'll ask them together. The first coming from Donald Noah. He asked, how does the graduate certificate in One Health benefit the recipient, and particularly how does it compare to seeking an MPH? The second along those similar lines comes from Solomon Olaronleke. He asks if you could share your thoughts on provisions for advanced studies like doctoral level in the One Health arena.
Sure. Well, I don't know that I have follow-up data to say here's specific examples of how the certificate in One Health has graduate student launch their career in the area they want to go. I think it's related to several other comments we've heard throughout the morning. The value of a certificate, as I see it, is it's an official recognition that that you showed up, that you attended, that you studied successfully an area, a topic area, in this case One Health. In many institutions, a certificate will appear in the transcript, and so if you're getting a PhD in microbiology, you can point to a certificate in health and leverage that if that's the direction that you want to take your career, or I guess you could pick whatever topic area there that you're doing your advanced study in, which PhDs are typically very narrowly focused to your course work, seminar work, and so forth. Have an official acknowledgement that you've accomplished something that's been approved at the academic level and defined as One Health. That just, I think, broadens your base experience. In terms of PhDs, we've heard some discussions today. AB talked about some of their programs. The ITRAP program, our PhD integrated training program in infectious disease, food safety, and public policy. I couldn't list them all, but my sense is you hear about more and more of these kinds of graduate programs are available that do kind of work at the interface of the health professions, and my personal bias is I think this is a growing area that we need, and that there will be career opportunities for those. Hope I answered the question.
Thank you, Dr. Freeman. I think that's excellent. We have another question, if there's time to respond. This one comes from Joanne Lindenmeyer. She asks, what are your thoughts on the prospects of funding streams to support student research groups comprised of students for various disciplines around One Health problems?
Well, Joanne, thanks for asking that question, and thanks also for reminding me just to mention funding streams. I got so wrapped up in thinking about students, I forgot to comment that with our One Health leadership experience, funding, getting all of the partners to participate in funding has not been easy. So you really you have to want to, and so each college, each unit, whatever, has to want to. In addition, we've been able to reach out for partnerships, and I do want to mention Zoetis. Ab mentioned Zoetis as well. Zoetis has recognized the innovation around educating students on One Health and leadership, and has been a partner in that program with us as well. So I think connecting with government agencies and industries that share that interest is a way to go as well. In terms of educational programs, again, in my experience, when we reached out to the University of Regina, the faculty of social work, they were very interested in working together on the veterinary social work program. Their funding model was different than ours, so we have to manage different funding levels, but the interest is there, and I think that's the most important. On campus, again, if you can connect people, connect interests, and then hopefully the funding can follow. And we've actually on campus on campus grant-related programs have been able to argue effectively for One Health-related programs, and especially as they connect across campus. Does that help?
Yeah, I think that was a great response, and again, really appreciate your excellent presentation. Pete, I think we're probably up on time. There's a few more questions, but we'll certainly get those onto the presenter for any responses that you may have.
Okay. Thanks, Jesse. Thank you again, Dr. Freeman. Thank you. So we have just about 15 minutes remaining, so please, stay with us for just a little bit longer. Dr. Cheryl Stroud's going to close us out here with some closing remarks. Cheryl, your microphone is now open.
Thank you, Peter, and thank you everybody for participating and joining in this webinar. I have found it extremely enlightening, and I want to thank everyone. Next slide, Peter. So one of the largest thank yous that we need to give is to Peter Costa, who is Associate Executive Director of the Commission and Webinar Master. He always manages somehow to pull these off flawlessly and professionally. So thank you, Peter, from everybody. I'm getting these thank yous from many directions today. Next slide. And to our speakers, thanks so much to everybody, especially Peter Jolly and Joanna McKenzie, who were up at 1:30 in the morning presenting, and our Romania guests who were presenting late in the day there. So thank you so much to the speakers. We are so happy and enlightened to hear what's going on all around the world. It's just so heartening. Next slide, Peter. And I would like to reiterate the point that I made this morning, that relationships don't just fall out of the air. They start with relationships, that we have to go out of our way to create opportunities to have the conversations and let those relationships develop. That's part of what we're doing here today. It's part of what's been going on for One Health Day. It's just so exciting to see people actually on a local level creating those relationships and heightening awareness for One Health. Next slide. So, as has been mentioned several times, One Health Day has exceeded our wildest expectations. Peter, correct me if I'm wrong. I think we're over 140 events. I know there's still some that have to be posted because they've been coming in so fast because people are just taking this whole resonance of One Health and taking action in their local areas. So One Health Day, just remember we'll be doing it again next year. And Peter, if you can switch to the One Health Day website screen real quick, I would just like to point out and thank everyone for helping us remember Jack Woodall. We've dedicated this first One Health Day to Jack Woodall. Many of you will be aware that he was quite instrumental in creating ProMed Mail. He was part of that leadership. He's also been a huge instrumental part of the One Health Initiative Autonomous Pro Bono team and overseeing the website and bringing ProMed postings to that. And he was one of the first to really listen to us when we said we wanted to create a One Health Day. He said, what? Because we were first thinking we would call it World One Health Day. And he said, no, wait a minute, that sounds like too much like World Health Day that WHO does. So we ended up just calling it One Health Day, and I'm noticing that a lot of people are starting to interject the word International One Health Day, so those are some things to think about. But we are dedicating this first One Health Day to Jack. So back to the slides, Peter. And the next one. As Peter mentioned this morning when we first started out, or earlier in the day, if you're late in your day, the goals of this webinar were to really connect One Health stakeholders all around the world so we can create partnerships and join hands to work together in coordinated actions to educate about One Health. Next slide. And I was able to give a very brief overview and some updates from the One Health world this morning. Next slide. and mentioned that I was not going to go into, in fact, none of our speakers took time to go into just what One Health is, but I am so appreciative to Dr. Freeman for reminding us. We did hear a lot about infectious diseases today. In fact, this happened in the first International Who's Who and One Health webinar. Somebody asked us toward the end of the webinar why we weren't hearing more about other aspects of One Health other than infectious diseases. So I'd just like to remind us that all those other things that Dr. Freeman was just mentioning and that a number of us have mentioned today, the comparative medicine and translational research, climate change, human-animal bond, antimicrobial resistance, all those are things that fall under the One Health umbrella, so to speak. So I really appreciate him mentioning that. And then I guess one of the things that we need to remember is that we heard a real common theme today about education. Next slide, Peter. A real common theme about education, that students are our future, that we all need to be passing the baton and preparing the next generation. And one thing that we feel is very important is to help these students create those relationships across the professions very early in their careers, because as Risa and Akil can tell you, though that relationship that they have been able to forge with their experience in Students for One Health is going to last through the rest of their lives. They've got a nice, strong friendship that they'll be reaching out to each other for the rest of their careers. So that's a really important point. And it's all about the other main take-home message today is it's all about partnerships. The partnerships that we can form as we work toward planetary health and global security, remembering that we really are talking about global security as much as global health, because One Health and a move is a pathway to planetary health and global security. Next slide. So here's my plea. Let us hear from you. Go ahead. Next slide, Peter. Get yourself on the Listserv so that you can get these little announcements and messages that we share. Even the One Health platform and a lot of the other groups, get yourself on multiple Listservs so you're sure you don't miss anything. Sometimes we'll miss, there'll be something that comes out through one group but not the other. We try really hard to make sure we're all sharing. Next slide. This is our way to get connected. Let us hear from you. Send us your information about your One Health programs and activities. If you're poking around on the One Health Commission website and you don't see something that needs to be there, please let us know. We're really, really anxious to get information from a lot of the groups that we have just learned about through One Health Day posted on our Who's Who page. So let us hear from you. We'd love to on this One Health, on this Who's Who and One Health web page, you'll see that there's a little template that you can download and send us some of your information just kind of in a standard form. If you like, we'll post anything you want to see about your group. Next slide. And then I'll just mention and reminder that there is a special One Health issue with several articles focusing on different regions of the world on One Health training, research, and outreach. This is another part of our celebration for One Health Day. This initiative was put together by Dr. Greg Gray at Duke University with Duke One Health. And it's going to be coming out this month in the journal Infection Ecology and Epidemiology, which is a journal that's hosted by One Health Sweden. Next slide. So again, what's the take-home message? That we are forming relationships that can lead to collaborations. And I can't remember, Peter, was that my last slide? I think I have one more. So this is my call again, that we all join hands and work together and network and make sure that we're interacting and communicating across all our different groups around the world so that we can actually operate and form a global One Health alliance. So I'm thanking everybody for participating today. It's been very enlightening for me and I hope for you. So we'll see you next time. Keep an eye out for future webinars.
Thanks, Cheryl. And I'd just like to take a moment to remind everyone that any questions that were submitted will be sent to the speakers for follow-up. But that is all the time we have today for this webinar. We'd like to sincerely thank all of our speakers today for making the webinar possible and all of our listeners for joining. I'd like to specifically thank my co-moderator, Jesse Blanton. Following this webinar, you'll receive a short 8-question evaluation. Please do take a minute to fill it out so we can continue these types of programs in the future. Also, we will have the recording of this webinar available on the One Health Commission website within 1 week, and we'll be emailing the web link and the recording announcement to all registrants. Once again, we'd like to thank everyone who made this webinar possible and hope that you'll join us again in the future. Have a great rest of your day. Thank you and goodbye.